Good morning. I'd like to call this meeting of the Lane County Board of Health to order. We have a Board of Health meeting before we get to our regular board meeting today, so there's going to be two opportunities for public comment today, one to the Board of Health and one to the regular board for those that are interested in providing public comment. So is there anyone signed up for public comment to the Board of Health? Okay. Then we will move on to Commissioner's response to public comments and or other issuance and remonstrance for the Board of Health. Commissioner Farr.
Thank you, Mr. Chair. I'd send a message that I have a visitor today. I'd like to introduce Savannah Lindstrom, a local high school senior who will be attending the University of Oregon next year. She came to visit my office this morning and will be staying for part of the Board of Health meeting. Savannah is, I've known Savannah since Savannah was born. And I'd like to welcome you here today, Savannah. Good luck with your studies, and thanks for all the great questions you fired by me this afternoon. And hopefully I was kind in my response talking about these guys.
Don't believe everything he says. Any other remonstrance? Thank you, Commissioner Farr. So with that, we'll move on to any emergency business for the Board of Health.
Not today.
That brings us to item 5 on the agenda, which is employee recognition. And I'd like to invite Ron Jelm, our Community Health Centers of Lane County Division Manager, and he has a couple guests he'll be introducing, and I'll turn it over to Mr. Mokrahysky.
Thank you, Mr. Chair. So Ron Jelm, our CHC manager, and we have Dr. Natalia Uzal and Dr. Rick Kincaid here with us today. We're trying to get a video up and running. Was it KMTR who did the video?
Yes.
KMTR did a fantastic video. It's about 5 minutes long, so if we don't get it, we'll send it out to the board. But just imagine our staff here looking and sounding phenomenal on local television and talking about really incredible work. So I'll share some comments and then turn it over to Ron to add to some of that. Dr. Kincaid is, as the board knows, our medical director for the Community Health Centers of Lane County, and Dr. Uzal is the CHC's clinical pharmacist. Both of these individuals were acknowledged last month by the Oregon Primary Care Association's Innovation and Leadership in Transformation Award for their leadership in addressing opioid use in our community. We know that this is opioid use and abuse is a significant challenge nationwide, and it's an issue here in Lane County. Over the last few decades, opioid misuse and abuse has gone from an escalating problem to a full-blown epidemic, with opioid overdoses claiming nearly 144 deaths per day, approximately 52,404 deaths for the year in the United States alone, even surpassing auto fatalities in number of deaths. So later in the meeting today, we're going to talk about fatal crash investigation work and the significant challenge we have in this community around traffic fatalities. This is opioid misuse and abuse and deaths rival traffic fatalities nationwide and in Lane County. In Lane County, we've seen a similar trend as the nation has, with an opioid overdose death rate of almost 10 deaths per 100,000 people. Dr. Kincaid and Dr. Uzal, as well as the dedicated team at the CHCs, have taken a community-wide, multidisciplinary, and collaborative approach that has spurred on the advent of systems and programs which will ensure fewer people are using opiates. This approach includes, and I'm going to have Ron go through some of the specific strategies that we've employed, but the approach generally includes some smaller doses for those who absolutely need them, and overall fewer deaths from overdose in communities throughout Lane County. To date, these efforts have already led to a 40% reduction in the number of CHC patients currently using opiates. So I'll say that again, a 40% reduction. These strategies that have been employed have resulted in a 40% reduction in the number of CHC patients using opiates. I shared this, Commissioner Lyken and I were at the National Association of Counties Legislative Conference in Washington, D.C. in early March. And as you all know, I serve on the board of directors for the National Association of County Administrators, and we at 3 times a year. We have sessions at these conferences called the Idea Exchange, and there were about 100 of my peers from around the country that were at the Idea Exchange. One of the topics that we had was opioid abuse in counties and what strategies counties were employed. So I reached out to Karen Gaffney, our Director of Health and Human Services, in advance of that, and I said, give me some talking points about the specific strategies. I shared that with 100 of my peers around the country, and they were blown away, both at the strategies and the results that we've had. I had several people come up to me afterwards and follow up on that. So at least in the circles that I interact nationally, Lane County is viewed by my peers, at least, as being a leader, and folks are seeking out these strategies that have been so effective. I'm going to pause there. Do we have the video? Are you still working on it?
We're going to find out.
We're going to find out. Okay. Well.
In the last 6 months, Lane County Community Health Centers have done what they say no other health organization in the country has been able to do. They've reduced the number of patients on opioids by about half. That means hundreds of people who once depended on opioids don't anymore.
To get out of a crisis, first, we have to know how we got here, how the country got here. More deaths from opioid overdoses than car accidents.
10 to 15 years, we kept trying to medicate more and more pain without the general knowledge that people can get addicted, and more so than we realized.
How Susan got here. So doped up, she called herself a zombie.
I had one doctor prescribing me constant oxycodone month after month after month, and it wasn't doing anything, so he would just keep upping the dose.
How Cricket got here. 50 years of opioid addiction.
By the time I was 10 or 11, I discovered my mom's pain pills and sleeping pills and my grandma's diet pills. And so, good, I feel better when I take one of these.
Every single one of the millions of Americans on opioids has a different story.
We got here a variety of ways, and we're going to get out of here in a variety of ways.
Lane County Community Health Centers has a way. Dr. Rick Kincaid is the medical director. He has a team that develops alternatives. They taper doses of opioid medications while adding other treatments like acupuncture or water therapy.
Empower people to be more active, to really take active roles in dealing with their pain and not turning necessarily to medications.
And it works. How do they know? They've done it. The Lane County Community Health Centers have reduced the number of patients using opioids by 40% in the last 6 months. Hundreds of people once on opioids now aren't. Like Cricket.
And I jumped on it. I was first in line. I was the first patient.
She does acupuncture weekly.
It's a regular pain that I've been having in my back and my neck.
She doesn't need the opioids anymore.
Pain is inevitable. Suffering is universal, but misery is a choice. I'm 65 and I made it.
Like Susan. She does acupuncture too, and lots of meditation.
My migraines are almost gone.
She can once again take care of her kids.
I am no longer a zombie, so that is fantastic. I can participate in life with my children. I can do homework with them. I can think. I can do so much more.
That's just 2 people. There are so many more. And doctors say these alternatives can be implemented across the country.
This is an epidemic that's been paralyzing our nation, paralyzing our small communities. We've watched it in the rearview mirror for far too long. Now we're looking out the windshield, and we're trying to make a difference going forward.
Doctors say it's just the start, but it's something. And it's more than we've been able to say for the past 2 decades.
The Lane County doctors work closely with pharmacists to taper patients off of the opioids slowly, and that reduces the chance of withdrawal. And then they say these alternative measures can be just as effective as those drugs.
Wow.
Well, what about those patients, though, that absolutely need those opioids?
Yeah, for those patients, they also try to lower the doses of medicine to limit risk. And for the patients who are still on higher doses, they give them naloxone, and that is just in case of overdose. It's an anti-overdose drug that they can have on hand.
Good direction they are going for sure, Audrey. Thank you so much. And moving on.
Well, that was worth the wait, wasn't it? Ron, do you want to talk a little bit about some of the specific strategies?
Sure, Steve, I'd love to. Thank you, Mr. Chair, Commissioners. The video gives a wonderful example of the outcomes with a couple of patients. We have been so blessed by having Dr. Kincaid for the last 2 years and Natalia for not even a year, and the tremendous difference that they have made in our organization. This is just one example of really a multidisciplinary approach to a very complex project with extraordinary results. Dr. Kincaid is extremely active here in Lane County with the coalition of providers and other agencies throughout the county, and working with ways to reduce opioid use. They have adopted CDC guidelines for dosage and really promoting the use of different registries and so forth so that there's better coordination across primary care offices, specialty offices, emergency departments, and that is just integral to the ability to address the issue. And the same approach within our organization in terms of a multidisciplinary approach and looking at different strategies that all come together to make a difference. We have a wellness committee that meets on a monthly basis, which is a multidisciplinary team that Dr. Kincaid heads with Natalia in terms of working with our providers to identify what are the best approaches for individual patients and to mentor and do that sort of peer mentoring. They've worked with our electronic medical records team to provide a much more facile way for the providers and the teams to identify who are on opioid doses and what the levels of the dosages are so that they can do those reductions. We've developed alternative care. I think we've talked here before about the development of our alternative care options. So we now have acupuncture, we have mindfulness, we have a waiting list for those. We look to expand that to take care of that waiting list. We have developed a relationship with the Tamarack warm water pool. I mean, I could just go on and on. You can see the enthusiasm, and these two folks have really led the effort, and so we're more than delighted to recognize their efforts.
Mr. Chair, the board recently approved the 3-year strategic plan for 2018 to 21, and one of the new components of that, as well as a lot of additional detail and metrics that we're going to be tracking, are some higher level components. And as part of that process that we went through, we identified 3 core behaviors that we believe our employees exhibit that are unique from other organizations: a passion to serve, a drive to connect, and a focus on solutions. And part of what we're wanting to do is lift up examples. I'm not sure how much the employees want to be recognized in this public fashion. Particularly these individuals, I know, want to do their work and they don't need the recognition, but we like bringing forward individuals that are examples of those 3 core behaviors. And these 2 individuals in particular represent all 3 of those. I think you've seen that through the examples here today. So want to echo Ron's comments and just thank both of you for the great work that you have done and that you are doing.
So any comments from the board? Commissioner Farr.
Thank you, Mr. Chair. Just one comment, but I didn't make these words up. A good direction they are going for sure. That's what was said on the. It's amazing the work that's been done here. And when I talk to people nationally about it, and when I talk to people at the state level, what we're doing in Lane County certainly is groundbreaking. And the number of people who are receiving relief from opioid use, heavy opioid use, is just remarkable. People are standing aghast. Not aghast, agape, I guess is the right word. But just a quick question regarding who are the patients that we're serving. Is it typically people who are receiving primary care through our health centers, through the FQHCs?
Commissioner Farr, board. The patients that we serve in our clinic are all receiving primary care services through our providers. At this point, we focused on our patients that we already have that responsibility, and this is a very vulnerable population with significant socioeconomic challenges, many of which have had very substantial trauma histories in their past and led to much of the challenges they have with pain and addiction. Our focus has really been to try to provide supportive services for those most vulnerable people. And as we try to leverage a variety of different technologies as well as people power and partnerships within our community in order to try to serve that population. But they are our patients that we're responsible for. And much as Pat's comments, that the solutions need to also not just be community solutions, but internally within healthcare. We need to be able to be responsible with our prescribing as well as responsible with the constellation of services that we offer to treat pain. And pain is real. And how that is experienced by each of us is different. And how those modalities that we need to bring present for those patients is different. So we need to be sensitive, patient-centered, and try to provide as much emotional, physical support as we can so that we have long-term success. Again, we don't want to take away something in one place only to have it show up somewhere else. We really need to provide a constellation of services that stabilizes that population and allows them to be successful in life and move forward. And some of the examples you saw in the testimony clearly from Susan Cricket, both are examples of people who have now can move forward in life. And I think that that's our goal.
And that's one thing that you and I have talked about is not displacing the issue, not to help assisting with the opioids and having people turn to something different. And something that Susan Cricket said, pain is universal. Everybody has pain, but misery is avoidable. And that's what we're all about, isn't it? Thank you very much.
Any other comments from the board? Commissioner Sorensen.
Well, once again, I just want to thank everybody involved with this program. When you think about it, what we've achieved in Lane County, and I mean it's a big we, right? It's thousands of people from the nonprofit advocates that got this thing going with their grant writing and the Congress passing operational legislation to allow these clinics, and now most recently the appropriations bill that gives us a couple of years of forward thinking and finance. So to me, the whole thing has really been rolled out to be a great success story. And then within that large success story is this very, very wonderful individual success story. And I think that this is the kind of thing where those of you that are involved with this could think about, well, how do we bring this to other communities? And I think that the idea that you could have this innovation, and I might even use the word entrepreneurship, of where a nonprofit local government comes up with a system that does work at the level of hundreds of people, maybe thousands, that could be replicated in other clinics, in other communities, in other community health centers around the country. And we might actually be able to be paid by those governments for the significant savings we'd be bringing to them. So I just think it's wonderful, and I just want you to really, as Saturday Night Live would say, explore the space and really explore the opportunity to take this great idea further. First maybe the state level, maybe the West, and maybe the whole country. I really think it's great, and I think that as we see these struggling states, Kentucky, West Virginia, I mean, these are horrible situations, and if we've found a way to do this and to do it humanely and inexpensively, the rest of the country's just starving for the solution. So if we have some of it here, let's take it on the road.
Commissioner Lycan.
Thank you, Mr. Chair. I just want to echo the sentiments of both Commissioner Farr and Commissioner Sorensen, and I would completely agree. Last year at the WIR, Mary Bono was the guest speaker talking about this very subject, and very, very passionate about it. And with her 16 years in Congress, she still has a lot of those connections. And what was interesting is that we traded information. So what I've been doing is basically forwarding her the work that you're doing, and then she's been forwarding that information to her former colleagues on Capitol Hill. And so it's kind of interesting because I think what's happening here is your work you're doing is now resonating with other people around the country. And I can't thank you enough for that. It's really, it's pretty amazing. And as you know, so Commissioner Fire and I both attended the Live Healthy Lane event. And I got to tell you, it was really interesting hearing from all the folks, not just here in this core, but throughout the Lane County. And that was a wonderful celebration, I got to tell you, it really was, and talks about exactly what we're trying to accomplish here. And I just want to say thank you to all of you and on the work that you're doing in particular. It's just, it's really glowing, and again, keep up the great work, but I just want to let you know that the work that you're doing, I think, is resonating beyond these borders and throughout the country. And because you just make contact with one individual who has obviously a lot more connections than any of us do back in, especially in Washington, D.C. But thank you very much.
Commissioner Williams.
Thank you, Mr. Chair. Well, thank you for the work that you do. It's an incredible achievement to turn this thing around and to be a leader, have leadership, which will have nationwide implications. Really appreciate that. I'm always struck by this one paragraph, and we've seen this before, about the number of deaths a day and the number of deaths annually to opioid fatalities. 52,404 annual deaths. That number always strikes me as the same number of deaths, plus or minus a few, that occurred during the Vietnam conflict. We lost over 52,000 military personnel in that conflict. And this number with the opioid issue equals that each year. It boggles my mind. I just have a hard time visualizing that much suffering, that much need that occurs in our general population. So thank you for being leaders in this, making a huge difference, and really appreciate that. Congratulations on that. More work to do. Thank you.
Thank you. And I just real quick want to repeat what everybody said by saying ditto. You guys are doing great work there. I know Rick and Natalia, it's sometimes hard to be recognized up front here. I noticed Rick squirming a little bit when he saw his face that big.
Scary.
He doesn't seem like the type person that normally would be in the spotlight. So I appreciate you letting us spotlight you for a few minutes here, because this is just amazing, the 40% reduction. And I just want to mention, Natalia, real quick, I really appreciate what you do. My mom has a PharmD and worked as a pharmacist. So, and although she stopped practicing about almost 20 years ago now, I remember her complaining about doctors and the scripts they write.
Has it changed?
Yeah. And just, you know, how they weren't, you know, communicating with each other about what their patients, other prescriptions and conflicts and everything else, and how sometimes it was the pharmacist that actually saved the patient's life from a conflict because, you know, two different providers weren't talking about what they were prescribing. And I really appreciate the work you do. And it's one of those unsung hero things of the health world, is that piece pharmacists play. So it's great to have you here to represent that. And it's great the role you're playing in tapering these folks down and providing alternatives, because I know it's a tough thing to do. So I really appreciate what you're doing, and 40% reduction is just amazing. And it's going to go a long ways. Those folks' lives are changing. You know, I've watched friends and family members struggle with opioids, and it's not an easy thing to go through. It controls your life in a lot of ways, and getting out from under that control is truly liberating for those folks. Those 40% that you guys have helped are going to live completely different lives from now on. So really appreciate the work you do. Any other comments from the board? Well, just one last time, thank you very much for your work, and congratulations.
Thank you.
We need to keep moving on. We've got a packed agenda today. Yeah, we need to move on. We've got two other Board of Health items. We've got a 10 o'clock time certain, 10:30 time certain we have to hit. So I'm sorry, David. We'll maybe during public comment. Thank you, everybody. So with that, we move on to item 6A, which is a report in the semi-annual Board of Health report, and we have Karen Gaffney and I think Dr. Lubke's here, and Brian. So with Brian Johnson, yeah. So I'm sure, and I'm sure there might be some topical stuff you might want to enlighten us on too, based on this morning's news. But I appreciate getting the report, and I've got a chance to read it up front. Pretty interesting information about seniors. So
excellent. Well, good morning, Chair Bozovich and Commissioners. I'll briefly introduce the item and then turn it over to Dr. Ludke and Brian to do our focused presentation, and then, as always, we'll leave plenty of time for questions and discussion. This is our semi-annual Board of Health report, and as is typical, we define health broadly, so really we view it as an opportunity to update you on the work that's happening in Health and Human Services. And in your written packet, we've provided brief summary updates from each of our 10 divisions, and we're happy to answer questions about any of that as you've gone through the packet. Before we get to that, though, the topic that we picked to highlight for the presentation today really winds up what has been our series on kind of the different life stages in terms of health indicators in the community. So I think we'll start with that, and then yes, there are a number of health issues currently in the community that we're perfectly happy to answer questions and discuss as well after we get through this brief presentation.
Very good. Thank you, Karen. Chair Bozovich and Commissioners, thank you as well. Brian and I are going to tag team today, and unlike, I think, the usual times where I bring poetry or some extemporaneous remarks, I actually wrote out my comments this time, and we're going to continue with our life course focus, and we're going to focus on the age 65 and above population in our community, and that's what you see predominantly in your report. And I'm going to come at this from a little bit of a different angle and then pitch it over to Brian. And the reason I'm doing so is because the math of healthcare costs in this country last year are just kind of too delicious to let pass without a comment. Our country last year had about 325 million persons in it, and our total healthcare costs were about $3.25 trillion last year. And the math of that is very simple. It's about $10,000 per every American. So each of us essentially had a $10,000 check written for our healthcare last year. And it's the easy part of that being the $10,000 estimate doesn't cover the statistics of, well, some people got through the year with probably no health care costs, and some people may have had an unlucky skiing accident and had several orthopedic surgeries and may have spent, $100,000 of that health care dollar. But it's worth noting that as we look at the life course focus of this report, that health care costs typically rise with age. And such that by age 65, half of the total costs that will be spent on healthcare in this country occur from age 65 on. So significant proportion of our healthcare dollar goes to this age group we're talking about today. It's also important to note the demographics of our county. We're not a very young county. Our median age is 39.1 years. The youngest state by far is Utah. Their median age is 29. So we're 10 years older than the youngest state. We're a little above the older average across the country, about 37 years. So we're not that young of a county. So in some ways, at least partially in terms of healthcare costs, the deck is a little bit stacked against us. But that being said, There are some things that we can do, some things that you have done that have really helped. And there are little things that can make a big impact. And the one I'm going to talk about briefly is tobacco. Tobacco costs, as you probably know, and you've heard from us multiple times, add up every single day, kind of like these opiate deaths we just discussed add up every single day. And the small impacts that we can change, if we could decrease, say, a 1% smoking use rate in our county, we could save lots of money. And Brian and I did those calculations based on a couple pretty famous articles in the tobacco world. Some of you have heard us talk about Stanton Glantz. He's a famous researcher in San Francisco on tobacco. And the estimates for our county, if we could just lower tobacco use rates by 1%, we would add an additional $80 million to our economy. $80 million bucks a year by a 1% decrease. And that's real money. If you look at essentially a zero-sum game of economic development, there's only so much money around, and if we're taking $80 million out every year for tobacco and healthcare costs, there's that much less money for us to grow our economy. So you have impacted that. Tobacco 21, a variety of tobacco-free and smoke-free spaces, funding for tobacco initiatives and community education. You have made a difference, and we have seen our rates drop slowly. We want to see them drop faster, but we've seen that significant improvement. So I'm going to pitch it to Brian now for some more specific details, but please keep that in mind, our demographics and some of these cost issues and how it is that we can move forward together.
And excuse me, good morning. It's great to be here again. And, you know, I really appreciate starting out with the tobacco in particular. If you look at, there's really two major themes in the chart of health indicators we sent your direction, and tobacco is one of the big ones that's in there, and you can see very, very quickly as you scan down a number of tobacco-related illnesses that have been on the decline in Lane County, and those are relatively recent phenomena, and in fact, we're starting to outpace the state a little bit, which is great to see. So in particular, cancer rates and heart disease and chronic lower respiratory disease and stroke are all on the decline in Lane County. Of course, when something goes down, something rises up a little bit along the way. But overall, this is really good news, and I think it's tremendous to be able to point to specifically some of the work we are doing and that the board is doing specifically to improve the conditions for health in the county. You know, I mentioned there were two sort of things that are driving what you're seeing on this as well, and one of the others is obesity, and obesity is actually starting to, in some ways, steal a little bit from our successes in tobacco, and I'd put that out there that actually that's one of our, it's not a new challenge, but it is a rising challenge for us in the sense that it's been consistently on the rise in Lane County, and also we know that folks are also finding it harder to be active as well as to gain access to affordable, healthy, and nutritious foods in our communities, which is something that we need to work for. And so what's happening along the way is while we're seeing some steady declines from tobacco, we're also seeing some diseases which are specifically related to activity and nutrition, which are either continuing to rise or are not declining as quickly as we might hope. For example, you'll see that stroke and asthma continue to rise, even though we might expect those to decline specifically from tobacco use. We're seeing diabetes and arthritis are relatively stable, which we would actually hope to start to see declining from other reasons. What else I would highlight there is that we're actually in a really good position in Lane County to do things about this. In fact, we're already doing some work in this area. For example, just trying to improve access to nutritious and healthy foods in our community. We're already investing specifically in opportunities, for example, our SNAP Match program, which attempts to really improve the buying power for folks with lower incomes at local farmers markets, which also supports our really actually pretty robust agricultural community that we have here. We are really actually lucky to be in an area where we have so much access to good nutritious foods, which is nearby, and we don't have to actually reach too far out of our community to make that possible. We currently also work together with Trillium and with the YMCA to improve access to classes and coaching for folks who are trying to manage the conditions and the chronic conditions that they currently are managing, which are influenced by these by this situation. And also, you know, if we look farther upstream, we're doing a fair amount of investment in our schools. So a lot of work in the K through 12 schools to improve the conditions for, access to opportunities to be active in the school system as well as access to good food. while at school, which really sets the stage for good, healthy lives to begin with, and also builds habits over a lifetime that will help those kids later on in life. So lastly, I also want to highlight out there's an interesting connection there between depression and suicide, and also physical activity and nutrition. And as you can see, we continue to struggle with this challenge in Lane County, and I think it's something that we've mentioned in our previous reports as well. It's a common theme throughout all age groups, and in particular, it's actually, surprisingly for many folks, much more common among folks 65 and older. So I know we're going to talk more about that in a future board report, so that's certainly something to keep your ear out for and your eyes open for the new information that we'll be bringing forward to the board. But I'll just point out in particular, just for us to keep in mind, that it is a common West Coast phenomenon for people, the high levels of suicide in our communities. Turns out it's relative even higher in Oregon, and Lane County tops that list right there in the mix. So I think there's plenty of opportunity for us to be making important impacts, and some of that work, of course, is related to addictions work, and our successes around opioids are going to have some impacts around that, but there are certainly other opportunities along the way. So with that, I think I'll wrap it up, and we can take questions from there.
Thank you. And Chair Bozievich, just to clarify, Brian was alluding to a report that Public Health is in the process of finalizing now around suicide in Lane County across all age ranges. And so you can expect, as the Board of Health, to receive that later this spring, and we'll dedicate some time specifically to address that issue with you.
Thank you. Questions on the report? So while I've got the public health experts sitting here for a second, do you want to maybe just say something about the whooping cough outbreak? And
Dr. Ludke?
Sure. So unfortunately, as we predicted, we have a whooping cough outbreak. And in some ways, it's something that's a little bit unavoidable. We do not have a vaccination rate in our community that we wish we had. And the fact that whooping cough is endemic, meaning that it's always at least present a little bit, it's going to take advantage of that crack in our armor and not having people immune. Karen and I were talking about this yesterday. It's always interesting how this is a respiratory condition, and you typically think of respiratory diseases spreading the most in the winter months when we're all inside breathing the same air, like influenza. For whatever reason, and we don't fully understand it, whooping cough typically comes late in the spring and into the early summer. And here we are, the first day of May, and we have an outbreak. So not unpredictable. We're lucky, I think, that our vaccination rate is as high as it is, but it's not as high as it could be to prevent what we call these big wildfire outbreaks. And the main concern with whooping cough is that it has the ability to spread very, very quickly. A typical influenza case will cause 2 other cases. We call that the reproduction number. Its repo number is 2. Whooping cough's reproduction number is 15 or 16. So one whooping cough case can cause 15 or 16 new ones in people who are not protected. And because we have a lot of people not protected, we are seeing an outbreak. I don't think we're going to have a massive outbreak like Washington State had in 2013 with thousands of cases and they had to shut down schools and such. I think our vaccination rate is high enough to prevent something that big, but I don't think we're going to stop at 10 cases. I think we're going to have some more, and we need to do our part to try to educate and get as many people protected as possible.
Yeah, and the really scary part is that it can be fatal for infants and really contagious to them. I wonder if the late spring has anything to do with the high tree pollen count and the inflammation with that, but that's what I suffer with this time of year.
You're not alone.
And Dr. Ludke, do you want to talk just briefly about the strategies that Public Health has been implementing to address the outbreak?
Sure. So we do indeed have several strategies. The first, of course, is education and try to get as many people vaccinated as possible. The second is to identify those persons in the school who have been exposed, assess if they are protected, and if they're not, nudge them to get vaccinated, or if they have an ongoing infection, whooping cough, nudge them to get treated with antibiotics. There's a simple 5-day course, and you can be cured of it. Or finally, if they are not protected, nudge them out of school for 21 days. That's the length of time we exclude students for the health of them and for the health of the class. And of course, it's always a challenge. We were talking briefly the other day, I think on Friday, if this were 3 or 4 weeks later in the school year, we might say we're going to ride it out because summer vacation is coming. But we have a bit over a month ahead of us, and a pretty busy month involving final exams and AP tests and all these things that happen at the school end of the year. We need to keep people healthy. So those are the predominant ones. Identify people at risk, nudge them to get vaccinated, practice respiratory etiquette, cover your cough and your sneeze, and wash your hands frequently, and then exclude students who are not vaccinated and who refuse to get vaccinated.
Commissioner Farr.
Thank you. I'll just briefly mention, I'm looking at page 5 of the agenda packet, which anybody can access online. It's the leading causes of death for age 65 and older. And there's a lot of emphasis placed on older adult health, particularly with Lane County at median age is 39, is that what you said? So, and 4 of the 5 leading causes of death were down in Lane County. 4 of the 5 leading causes of death. That's a pretty phenomenal statistic. And I just really, this entire report is really eye-opening, particularly as we get down to the behavioral health portion of it and the amount of effort that we're putting into behavioral health, making certain that people who have both substance use issues and mental health issues are being, their health needs are being addressed, and stability of the living environment. And I'd like to take this opportunity to point out the fact that in behavioral health and in housing, working together, we do have Operation 600, which is underway right now, which is adding 600 behavioral health supportive housing units between now and 2021. I'd like to thank you for your help on that. And teaming housing, health, and behavioral health together is such an important element of making certain that our resources are used effectively. So thank you for that. And one last thing I'll point out is that Commissioner Lyken mentioned that we were at the Live Well Summit 2 weeks ago. Well, last week, Commissioner Lyken and I were also at the Teen Suicide Prevention Summit. And I wanted to thank you for the incredible presence that Lane County had at that summit. I think there were in excess of 100 people in the room, and there were about 40 people at the big table. And a large portion of that table was occupied by Lane County staff. And I'd like to thank you for the resources that you're placing into that and the importance that you're placing on addressing the severity of teen suicide in our community. So thank you very much. What a great report.
Thank you, Commissioner Farr, and I appreciate you pointing out the behavioral health tie with older adults in particular. And I would mention that through our Trillium Behavioral Health Unit, we're leading an older adult behavioral health initiative in the community, working closely with senior and disabled services to identify older adults who have behavioral health issues who aren't connected to services, really helping connect people to services, help our service providers understand how better to serve that population. And actually, our staff are now under contract to do that project as well in Coos and Curry County because we've done such an excellent job here in Lane County. So that behavioral health piece for older adults is a real critical piece.
And one last thing I'll point out, something that Commissioner Williams and I talk about all the time, is the outreach that you're providing to the entire county. You know, it's relatively easy to access services here in the metropolitan area, but reaching out to Oak Ridge and Florence and the more remote, more difficult to access services areas of the county, excellent work in that area. Good attention to details there. I drove past the Orchid Clinic on the way to the lakes and back from the lakes, and what a great location there and in Oak Ridge. So thank you very much.
Commissioner Lyken.
Thank you, Mr. Chair. So, Dr. Lutke, I'd like to kind of go back. You were mentioning about the median age, and I think it's kind of interesting because I don't see Oregon's median age dropping anytime soon. In fact, it's going to continue to increase. And when you mentioned Utah being the youngest, and in fact, Idaho is actually younger than us as well, and which I was just kind of looking here. As we look at this, but one of the areas, and I don't know if this is something, because I think this could be part of the public health conversation, is the fact that this area is one of the tightest areas when it comes to housing, really in the entire West Coast. Boise, up until recently, has they all of a sudden have gotten, housing's become tighter in the Boise area within the last year. The difference there is, of course, their land use system is so much different than ours that if they want to increase housing, they can go out and increase housing and really not have to go through a lot of hoops like happens here in the state of Oregon. My question, though, really focuses on the median age. So you mentioned Utah, and ironically, and I brought up Idaho for this reason, and I'm glad you said Utah, because the two hottest markets when it comes to economic development and business are Provo, Utah, and Boise, Idaho, out here on the West Coast. And in fact, they're known as two of the hottest high-tech markets, if you can believe that. I mean, who would ever thought Provo, Utah? But that is the reality. That's what's happening. And a lot of that is because it's more affordable. Housing's easier to get. And younger folks are flocking to those communities. So has public health looked at the correlation between housing, median age, and health as a whole? And if not, is this something that you may look at and try to maybe bring that together? Because I think there's potentially a correlation there. And over the years, we talked about the economic development piece and what that means for the public health piece. So I don't know. It's a question. If you don't have an answer for it, I'm fine with that too. Or if you have maybe opinions on it, I think it would be worthwhile to hear your opinions based on the fact that I view you as the public health experts, both of you. And so just maybe some thoughts on that. And because like I said, I don't think there's a way we're going to stop this. I think Oregon and Lane County is going to continue to increase in median age, but maybe just some general thoughts.
So I bet Brian and I both have some thoughts, and they're probably pretty different on this. As we were looking at some of this demographic info in this life course focus that we have, wanted to compare to some other metropolitan areas and states in the country, and it's interesting when you look at dynamism of a region and age, some of the economic data that comes out of it, and a good deal of it is skewed towards economic opportunity, but there are a few outliers. So, for example, Washington, D.C. is one of our youngest cities. And it's kind of a surprise because it ain't cheap to live there. But they draw youngsters for other reasons. You know, all those nonprofits and those mover and shaker kind of groups that there are jobs there. So there are some outliers, but by and large, there are links. And I think Brian's looked at this more than I have, actually. Probably have some comments.
Well, I mean, I guess I just put out there, the main point being there, yeah, clearly housing is, and affordable housing in particular, is very tied into to many different things that really influence health. In particular, it can affect how far a person's paycheck will go just in general as to what they can afford and where they live, where they choose to live, and it results in different sort of patterns of where people collect and live in the community and what they have access to. So I mean, I think indirectly housing can certainly impact where people choose to live and then what they can do from where they're living, and we know that it varies quite a bit across our communities as to how affordable it is and where people choose to live overall. I think it can be an important driver too as to what draws people to the community and and bringing new jobs and opportunity as well. So, I mean, essentially, that's the key takeaway, though. Housing is critical. It's right in the middle of our community health improvement plan. I think we talked about that a little bit the other day. It's all and very much for those same reasons that you're talking about. So I think it's a good point.
Well, and I appreciate that, and I bring up the high-tech industry because that does attract a younger age group overall, especially getting started. And the Technology Association of Oregon has a local chapter here that's been very aggressive and trying to recruit high-tech companies, especially traveling down in the Bay Area and talking about affordable. Because the reality is, affordability here is night and day when you look at the Bay Area. And so that's why I asked that question. And so there's work underway in trying to attract and bring folks in. But I remember seeing the census when you looked at 2000 and 2010, and you looked at the age group, what I call the youth, and it was an X number in 2000, and then it had dropped substantially in 2010. I mean, that was pretty amazing to me to see how the numbers really fell off between 2000 and 2010. I'll be curious if, and this is Lane County focused, I'll be curious to see what it looks like in 2020 in the next system census, if there's improvement or it's remaining the same. And I think that information will kind of tell us, you know, what are some of the ongoing needs and how do we address those. I think, as you mentioned in our strategic plan update, I mean, housing is a very, very high priority. And to me, that really works well, not just on the economic side, but in the public health side too. And so I'm glad to hear that you've looked at this and continue to look at this, because I think it's an important correlation and it's something, as you know, this board is really interested in pursuing. So thank you very much for that update. And again, for the whole report, I'm always amazed really and how you're able to break down our demographics. And today we're looking at that 65 and older and what that looks like here in Lane County. I look forward to the reports on other parts of the population as well. But I'm really amazed on the data that you have here and how we look at this and it gives us just really excellent information on maybe some of our decision making and how we should be positioning ourselves in the future. And so appreciate that. Great work. Thank you.
Any other comments from the board or questions? I'll just, because we probably need to move along, I'll make a couple quick comments. Really appreciate the focus on life stages and all, and looking at this particular segment of older adults. And just want to say, you know, my wife and I are both dealing with aging parents, and the issue of mental health of those parents, and dealing with, you know, a primary care provider across the country for my father-in-law, a World War II veteran, that we can tell from across the country he's dealing with some depression issues, but his primary care provider, who he's had forever, won't recognize that and deal with it. And it's a real difficult thing to deal with that, you know, from a distance. And also it's really a critical issue as those folks age, that there does tend to be that non-recognition, and some of their, you know, as they hold on to, you know, primary care providers may not have kept up so much and be cognizant of some of the issues that elder folks are facing with behavioral health. And I really appreciate that Commissioner Lyken brought up the whole idea of housing burden and the stress that causes, because we all know stress and health are directly related, and the financial burdens of our housing market here are causing a lot of stress in families, and we see that in a lot of our public health. But I just want to thank you all and recognize that public health is one of the few mandated services we must provide as a county. You know, and this is, you know, as we talk about our public health department, it's one place where general funds actually go into health and human services from the county. And so one of the few places, that and youth services. And for the most part, everything else we talk about, you know, the federally qualified health clinics and all that are supported with other funding. But this is the one place we are mandated to provide service and provide general funds for that service. And I really appreciate the work you guys do. Amazing statistics you always bring forward. Amazing reaction to in-the-moment public health crises, whether it's today with whooping cough or in the past with meningitis at U of O. You guys do spectacular work, and I just want to thank you for your work.
Thank you very much, Commissioner.
So with that, we'll move on to item 6B, which is a presentation. And speaking of community health centers, we'll bring back Ron Joan, and we're going to get a report on the audit of the community health centers of Lane County.
Yes, Chair Bozovich, as Ron gets settled in, you might recall several weeks ago, I believe Commissioner Farr asked for us to bring back a report on an audit that we received from the federal government, and Commissioner Farr was able to participate as the board liaison to our health council in that interview and multi-day session. And so Ron is here to walk you through the audit, and now we actually have the final results from that audit as well. So I'll turn it over to Ron.
Thank you, Karen. Mr. Chair, Commissioners. As Karen indicated, we have the opportunity on a biannual basis to be audited by our friends in Washington from the Bureau of Primary Health Care and the Health Services Administration, which is the agency that governs and oversees and covers federally qualified health centers. As a side note, they were audited by the OMB that found that they weren't doing quite the job that they should have been doing in audits, and so they have stepped up their game considerably. And so they have program requirements in 18 different areas. It's a raft of regulations, notebook thick, that covers the waterfront of the areas of operation for a federally qualified health center, that include the review of the services that the health center are required to provide, the staffing, both the level, the complexity, the certification of the staffing at the health centers, a whole laundry list of issues related to the clinical care that is provided, the governance, a good amount of review of governance, which is particularly an issue when the reviewers come to review us, because we are a co-applicant. They are used to reviewing standalone health centers, if you will, that are not part of governmental agencies, and invariably when the reviewers come to see us, we're a bit of an anomaly, I think in a good way, but always presents an issue when they come to look at the governance structure and the involvement of the health advisory councils and the Board of Commissioners. They also review at great length the financial underpinnings and the operations and the audit controls of the organization, and then a review of general operations. So it is a very comprehensive review. As I said, it is done every 2 years, and they are now on track, I'm happy to say. There was a 7-year gap between their first audit when I came on board and the most recent, and now they're on a 2-year cycle. So we had the opportunity to have the reviewers come on board for 3 days in February, and they bring 3 reviewers who look at one each for our clinical area, our financial area, and our governance structure, along with a program officer from the Bureau of Primary Health Care, and they go through a very extensive review. I will say in preparation for that, we did take a photo of the binders that we put together of policies and procedures and documents to support of the review, and that list is about 6 linear feet of binders and materials. So it's extremely extensive, and I guess in the slides we do have a photo of those binders for you. The amount of staff work is extraordinary, but you know the reviews serve an extraordinary purpose. It is to ensure that we are doing the work that the Bureau of Primary Health Care and HRSA expects us to do in all of those program areas. And invariably, when we prepare for those reviews, we find things. Some are not major things, but they help us up the game. They make sure that we are up to date in our policies and procedures, that we make sure that we're actually doing what we say in our policies and procedures, which is a nice thing. But it also is an opportunity to really reflect on are we meeting the standards that the Bureau of Primary Health Care has in place so that we're meeting the patient care needs of the community that we serve. At the end of the day, that's the primary purpose of the review. A very extensive review. Commissioner Farr participated in the conversations with the reviewers in terms of the governance.
And I wrote down some quotes.
And you have some quotes. Be happy to hear some of those. And I have to say I'm delighted to report to you all that at the end of the day, when all was said and done and we got the written review, we were fully compliant in 91 out of 92 specific measures that they looked at. The sole deficiency that we had was a deficiency that the finance reviewer said he's never done a review that has not had that deficiency, and that quite frankly has to do with our arrangements where we make referrals out to providers in the community. And we are to have written agreements for sliding fee schedules for those individuals who are at a lower income level and uninsured. And as I say in Nursing 101, if it isn't documented, it isn't done. So as an example, we have a long-standing, wonderful relationship with Peace Health to make referrals out of our prenatal program for labor and delivery and for postpartum care. They have a discount program that they offer to patients who are uninsured. Many of us thought that was embodied in the contract, and we realized, even though that operationally it has been in place for many, many years, it wasn't written down in the contract. Nursing 101, if it isn't documented, it wasn't done. So that's an example of that deficiency. We also had a couple others in terms of radiology referrals that we're working on, but pretty minor deficiencies. So we are very, very pleased with the results of that, and just delighted to have gone through that. I will say to your comments, Commissioner Sorensen and Commissioner Lyken, with respect to the opioid program that we recognized earlier today, the reviewers did come away. They look for best practices that they can take and disseminate throughout the country, and our opioid reduction program was one of those that they identified, and they were very interested in, and really took home a lot of notes about our opioid reduction program, and highlighted that in the exit conference as well as in the written report. A couple comments in the exit conference from the reviewers. They pointed out our stellar work in providing service to the community, that we are excellent stewards of federal dollars, and we're doing a great job of building relationships throughout the community. So we're very pleased to report that. And as a side note, I will say that we're batting 1,000 on reviews, not on the agenda today, but just real quickly, we've had 2 other additional reviews of our programs in the last 60 days or so. A second one was a review of our school-based health center by the state authority, and then the third was a review of our patient-centered medical home program at our Riverstone clinic, also by Oregon Health Authority. And I'm delighted to tell you that both of those reviews also had no deficiencies. So we're really pleased, and quite frankly, those are just great reflections of the work that our overall staff are doing to provide service. So happy to provide that report to you.
And Chair Bozievich, if I could just add my appreciation to Ron and Lori McKay and their staff, who did tremendous work preparing for these reviews. There is a tremendous amount of homework that goes in addition to the daily work of seeing the patients, which is clearly our priority. And they really did come through with flying colors, and it showed the commitment that the staff have to the quality of work, and couldn't be prouder of the work that's happening at the health centers.
Excellent. I can't imagine what it's like to do it every 2 years. When I was at Lane Community College, I participated in our 10-year recertification by the national accreditation, and it was an incredible effort by the community college staff, while they still had to perform all their regular duties, to do that 10-year, but to do a 2-year cycle with 6 feet of binders is pretty impressive. So great work, and awesome. The 91 out of 92, and the 92nd was more technical than anything. So I appreciate that. Any comments from the board? Commissioner Farr, as you asked to bring this forward.
Just a couple of quotes, if I may. I did spend quite a bit of time with the reviewers and with staff as you presented. A great deal of work went into the presentation. I don't think the binders do justice to the amount of work that went into the presentation. And one thing that was said is that out of 93 areas, maybe 1, maybe 2 areas were deficient. Turns out only 1, and it turns out that it wasn't really. We just hadn't written it down. So excellent work. But the quotes, the very general quotes, but the first thing I'd like to say is that the model is so beautiful. And talking about our opioid reduction model, and that you are doing things that the world needs to hear about. Now, this is coming from the HRSA reviewers. This is the words of the main reviewer, Jimmy, and I wrote down Jimmy Brown, but I don't think that was it? Yes. It was Jimmy Brown, okay. I thought maybe I just mistakenly wrote that. He also said, during the review, at the end of the review, I'll save that one until last. The second of three quotes is, the consistent message is that you are doing a great job. And that was across the board, out of the 18 different chapter items that they addressed. Across the board, you are doing a great job. And the final thing that Jimmy Brown did, the final thing that he said, and he followed through on this, he said, I would be remiss in not leading a round of applause. And with that, he started the applause for staff in the room of HRSA reviewers. It was an amazing thing. I didn't know how to respond to that. And this is a man who has recently gone through some criticism for the way they had been reviewing, so they were being particularly strident in the way they were reviewing. And for me, this, you said you've only had 2 reviews since you got here. Well, I've also been on 2 reviews since I got here, quite a bit after you. It's just happened to be 2 years apart. And compared to the last one, this one seemed more strict, and the points that they were making were more direct. But you made it on 92 out of 93 or 91
out of 92.
91 out of 92.
We strive for perfection, but we're not quite.
Not quite there. It's just amazing. But I think that Jimmy Brown summed it up with, I'd be remiss in not leading a round of applause, and I would be remiss in not leading a round of applause for what we did. Thank you.
Any other comments from the board or questions? Great job. I really appreciate the work you guys do. I'm just looking forward to maybe expanding your services to some of our more rural communities like Florence and Cottage Grove. But I understand there may be some plans for that in the future. But
it's entirely possible.
Yeah. So keep up the great work. Really appreciate it.
Thank you.
Excellent audit. I'll send you all of the quotes, by the way.
Yeah. So is there any other business for the Board of Health this morning? Seeing and hearing none, I'm going to adjourn the Board of Health meeting, and I'm going to do something a little unusual. I'm going to take about a 3-minute break here so that we can move computers and get reset for the regular board meeting. So we are going to adjourn the Board of Health, and I'll reconvene the regular meeting at about 10 after. I'd like to call this regular meeting of the Lane County Board of Commissioners to order for Tuesday, May 1st, 2018. And the first item of business is any adjustments to the agenda. Any adjustments to the agenda from the board? I see none, so we'll move on to item 2, which is public comment, where folks get 3 minutes to address the board. And the first person I have signed up for public comment is Carol Shearer, followed by Ellen Furstner. Carol?
Good morning. I'm in Commissioner Williams' district. I'm back again to talk about SB 941, which is the Oregon Firearms Safety Act, which I believe is not being enforced by Lane County. So I really appreciate Commissioner Sorensen because he is a gun sense measure advocate, but I feel like the other 4 of you are not, and I don't know how the Lane County Sheriff is, and I don't know how the DA is. So this is directed to those that I'm not sure about as far as gun sense measure candidate or people that care about gun measures that are sensible. And the people that are strongly gun rights advocates, one of the messages they say is that we need to enforce the laws that are on the books. This is a law that's on the books. It started in 2015, and it adds the requirement of a background check for firearm transfers between private parties to existing laws, which has exemptions for some individuals. So I think the people are going to continue to address this until there is some response as to how this is being considered by the 4 commissioners, the county sheriff, and also the DA. And it's also a public health issue. I think about my 6-year-old little boy that I'm an auntie to, who walked out with his first grade class here in Eugene March 14th to honor the 14 students that were killed, and the fact that he does have safety drills at the age of 6. And I wonder about how this is going to affect him as he grows. Where is he going to feel safe if he can't be safe in his own school? It also brings to mind my friend who is suffering currently with severe emotional issues. She's a retired 10-year military veteran who laid her body over a woman to keep her quiet in Clackamas Town Center as the shooter was active, and they laid next to a man who had his head blown off. The shooter came to my friend and put the gun to her head and pulled the trigger. The gun did not fire. Today I received another message from her that she's having a lot of problems today functioning, and is saying that she needs to have time to herself because she is having a lot of challenges just dealing with life. She's in her 30s. She's very talented. It's a waste. There's a cost to not enforcing sensible gun measures. And I think about how our society is being affected by being so fearful. It's giving more power to the NRA. As we become more afraid, they become more powerful. So please follow what the gun rights advocates say. Enforce the laws that are on the books. Thank you.
Thank you. Ellen Furstner, followed by Andrew Frost.
Hi there, I'm Ellen Furstner. I live in Marcola. First of all, I want to thank the health department for their wonderful presentation and everything that they do. Although I am turning 65 next year and it looks like I'm going to go downhill, according to their statistics. I had about $20 worth of medical bills this year or last year. I also want to say I had foster kids for the last 10 years, and most of their primary care physicians were in the health clinics, and I have no never been so impressed with doctors and staff as I had been in these clinics. They were, I thought, much better than any private physician or doctor's office I've ever been to. They were very, very conscientious with my kids who had multiple mental and physical problems. So I'm also here talking to support Carol in her support of SB 941, which add background checks in certain conditions for firearms. You said that public health is one of the few mandated services you have to provide, and gun violence, gun issues are a public health issue. One of you, I believe it was Commissioner Williams, was talking about the 52,000 opioid deaths, comparing them to Vietnam deaths. There are also a lot of gun deaths. I don't have the numbers right here, and I believe that a majority of gun deaths are also suicide deaths, which is a public health issue. I have some gun experience too that I have witnessed or gone through. I live in the Marcola Hills. Last summer, people shoot guns in the hills all the time. We hear it almost every day. Somebody shot a rifle or some kind of high-powered gun, and it hit a barbecue in somebody's patio who was barbecuing. 2 years ago, a gunshot went through somebody's wall, went through her bathroom, and went through the second wall. And the sheriff came by and said, some of these guns can shoot up to 2 miles with that much power. Also, my son's best friend in Thurston High School was shot. The girl next to her was killed. And then to just know that we live in a gun culture, I was doing a honk and wave for one of the county commissioner candidates last Thursday, and a man stopped in front of me and showed me his gun. I was by myself. I wasn't particularly scared because there was a lot of traffic, but that's the kind of culture we live in, that people feel comfortable pulling out a gun, and I took it as a threat. I mean, what else can you do? It wasn't like I was going to admire his gun. So I don't know if these were legal or illegal gun possessions with all these different things that I've experienced, and I've experienced many more. But we live in a gun culture. It's a public health issue, and you are in a position to do something about it. Standing up for this law to get more background checks, which makes very common sense. I'm not asking you to take everybody's gun away, but background checks are very important, and education about guns is very important. I live in the country. Just about everybody has a gun. A lot of people are very conscientious. A lot of people get drunk and go out and shoot in the hills. A lot of people don't care. A lot of people feel like it makes them a tough guy or a tough gal. We need to have leadership that says that, okay, you want a gun, then be responsible with it and control yourself, control your community. It is a health issue, and it is something that can be kept under control because other countries do it, and other states are also starting to do it. So I'm asking you to do that. And also, as another public health issue, you know, and I don't have to go on a lot about this, that there is a citizens initiative to ban spraying of forests. These sprays also go over our foods, which one of the gentlemen talked about, our nutrition, our healthy foods. A lot of farmers in Lane County are organic farmers. We can't advertise as organic anymore if our foods are being sprayed. And also if the air that we breathe is being sprayed, it's also a health issue. Thank you.
Thank you. So Andrew Frost.
Hi, I'm Andrew Frost. I'm here yet again. Several issues this time. One, obviously you guys think it's completely, I brought to you this issue about taxation, giving people 31 days to pay property tax. the same amount that payday loan companies are required to give people. You obviously don't give anything about that, really. Mr. Lykin, I phoned you up on the 20th of November, and you told me that you had spoken to the tax man and that it was sorted, giving me the impression that when my check got cashed, that we were good. Then I get a bill the other day for an amount with a number on it that I haven't got any record of, even in the bill they sent to me previously. So the tax man, is this because I came here and sought some representation that now that whatever you said is out the window? That's pretty shady. Now on this gun issue, some of you like to claim there's a Second Amendment right, blah, blah, blah. If you check your Second Amendment, that was ratified the same year they ratified the Militia Act. And the Militia Act's very specific about what guns, how much, and the registration requirements and the chain of command. A chain of command that would have put most of the people in the last 8 years of the Obama administration in jail for treason. If you check out the Militia Act, ratified the same year as your Second Amendment. So I'd like to have a little bit more honesty on the phone next time, Mr. Lykin. I understand that he might have just gone behind your back and done something. I find it complete shenanigans that you guys think it's okay and completely ignorable. The idea that people on fixed incomes, and this is a fact of life, if you only get paid once a month, getting a bill with a 21-day notice is a little bit of screwy. It's also a fact of life that a lot of people in the poorer end of the income scale keep those bills to the end of the month. And when it's post-dated for a month, they think they've got a month. They didn't necessarily think 21 days. This is a little scam to get a little bit more money. It's not really hitting the poorest end most of the time. But it's okay, I'll pay that up, but I'll know exactly that none of you gave a damn. One of you lied to me, and you're all risking all of our lives because you're ignoring the law that requires you to bring in some gun background checks. And you want to sit here and talk about you and the rule of law while you ignore the law.
Thank you. So that's everyone I have signed up for public comment this morning. With that, we'll move on to Commissioners' response to public comments and/or other issues in remonstrance. Commissioner Sorensen.
I just wanted to thank all the people that came in for public comment, raising the issues that you've raised, and I hope that part of the process of having public comment is for people to come in, be able to address their elected officials, and it's not always clear whether a specific person coming in and making a specific request has any immediate response. But I think overall our society is better served by having people that are able and willing to come into local government meetings and raise their issues. Obviously, not all the commissioners agree with all of the comments that are made, so the fact that people make comments doesn't mean that the commissioners agree with them. But I do think it's important to have this opportunity, and I appreciate the people that have taken the time to come in.
Any further remonstrance from the board? Commissioner Farr.
Not a remonstrance, just a heads up. When we get to commission business, I'm going to talk about Hayward Field a little bit. That's all.
Thank you. Anything else? Thank you. So we'll move on in the agenda. Is there any emergency business today?
No.
Which gets us to the consent calendar, which are items that are normally considered routine by the commission and are addressed in a single motion without discussion. If somebody wanted to discuss one of the consent items, it would have been pulled under adjustments to agenda. Anyone wants to see the detail of the consent calendar, they can go to our agenda online and click the view material for each item. Is there a motion to approve today's consent calendar? Commissioner Lykin.
Thank you, Mr. Chair. So I'd like to approve the consent calendar.
Second.
Motion by Commissioner Likens, seconded by Commissioner Williams to approve the consent calendar for May 1st, 2018. All those in favor, please say aye.
Aye.
Any opposed? It's approved unanimously. Thank you. Which moves us to item 6A, Public Works, which is the first reading and setting a second reading and public hearing for Ordinance 1356 in the matter of co-adopting amendments to the Coburg Comprehensive Plan, including expanding the urban growth boundary for employment land, repealing ordinance number PA 1315, and adopting savings and severability clauses, file number 509 PA 1405404. And we have Ms. Eichner.
Good morning, Chair, Commissioners. Today, staff request move for approval of the first reading and setting of the second reading public hearing at 1:30 p.m. on May 15th.
Thank you. Any questions for staff? Commissioner Sorensen.
Thank you. I wanted to note for the record what I might call a possible notice of conflict of interest involving me and this item. One of the, and this is fairly remote, but in the interest of disclosure, I wanted to bring this up. There's 514 pages attached to this item, and so I was going through it, and I noticed that one of the groups mentioned was Land Watch Lane County. What I don't know, and what I'm just putting on the record as a precautionary measure, is that Land Watch Lane County in some instances has been represented by a law firm that Sean Malone is in. And this is fairly remote, but I wanted to put it on the record. Sean Malone's law firm and a law firm, my law firm, have been involved in litigation outside of Oregon, outside of Lane County, having nothing to do with Land Watch or Oregon land use law. But that, kind of derivative conflict might be an issue. I don't know. I doubt it, but I don't know. So I'm just noting this for the record that Mr. Malone's law firm, my law firm, and again, I'm a part-time lawyer. I'm a full-time commissioner, part-time lawyer. So I don't work on these things that much. But when I do, they could be it could be involved. I don't know if Mr. Malone was involved in this case or not. I didn't have time to look at all 514 pages, but my sense is that that he has been representing them, and I just want to get this on the record.
Thank you. Any other questions or comments from the board? If not, I'll entertain a motion. Commissioner Leichten.
Thank you, Mr. Chair. And before I make the motion, do we need a specific time? Do you need
1:30?
1:30 is okay. Very good. So, Mr. Chair, I'd like to move the first reading and setting of the second reading public hearing ordinance 1356, the matter of co-adopting amendments to the Coburg Comprehensive Plan, including expanding the urban growth boundary for employment land, repealing ordinance number PA 1315, and adopting the savings and severability clauses, setting it for May 15th at 1:30 p.m.
Second.
It's been moved by Commissioner Leichten and seconded by Commissioner Williams to approve the first reading and setting the second reading and public hearing for May 15th at 1:30 time certain. Any discussion to the motion? Seeing and hearing none, all those in favor, please say aye.
Aye.
Aye. Any opposed? Motion passes unanimously. Thank you. So that moves us on to county administration announcements.
I think I can do at least an election update in 1 minute before the time certain. Voter registration is currently at 251,000. That's the highest registration to date. Everyone knows the election is in 2 weeks from today. The deadline for the election is 2 days from today, 2 weeks from today. Last minute party affiliation and address changes from the April 24th registration deadline have been processed and ballots have been mailed this past Friday, so everyone should have received them. At this point, we processed 10,602 voter registration transactions for the month of April. That compared to 5,071 in March. All 20 Dropbox locations are open and ready to receive ballots. No stamp is required when utilizing the Dropbox. I have ballots in my car waiting to be turned in to the Dropbox. And we're planning for a voter turnout of somewhere between 30 to 35%. Our Lane County Clerk, Cheryl Betchert, says, of course, higher is always preferred. So we'll take more than that, but we're estimating about a 30 to 35% return. I'll provide another update on elections next week and on Election Day. If you want to go to your 10:30.
Yeah, I was going to say, with that, I'm going to skip down to item 8A, which is a 10:30 time certain item, because we have staff here to work on that, and I think they've got to get some slides up and all that good stuff. So this is the second reading and public hearing for Ordinance 1803 in the matter of amending Lane Code Chapter 9 to update public health provisions 9.500 through 9.562, 9.566 through 9.685. And we have Ms. Gaffney and a supporting cast. So.
Indeed. Thank you, Chair Bozievich and Commissioners. We're here for second reading on these lane code changes. And with me today is Jeff Lang, who supervises our environmental health section in public health, and Jocelyn Warren, our public health manager. So I'll say a few words while she gets her slides set. As I mentioned during first reading, our effort today is to update the language in code. It has fallen over time away from what current statutes and OARs require and really what's currently reflected in our programs. So the code changes that we've proposed reflect that update. And in terms of the staff presentation, I'm going to turn that over to Jocelyn to walk through what the proposed changes are and really give you a little bit more information about our environmental health program as well.
Thank you, Chair Bozievich and Commissioners. I appreciate this opportunity to talk a little bit about the code changes. It's not very significant, but I realized as we were reviewing the changes and looking at all the red there, it seemed like we were taking a lot of things out and that we weren't doing a whole lot around, especially safe drinking water. So I wanted an opportunity just to kind of update you a little bit, especially on the safe drinking water program. The updates that were made were to three kind of larger pieces: the Declaration of Danger to Public Health, the Safe Drinking Water Program, and the Food Handler Certificate. And a lot of this really was language that was updated to reflect our current contracts with the Oregon Health Authority, and also the division of responsibility between the state and local jurisdictions. But the piece that I'd like to really highlight, and I think this is a great opportunity, I know we have interest in safe drinking water on the board. It's also, I'd like to note, the birth of modern public health really began with the water crisis in London, with cholera and John Snow and the Broad Street pump. So this water is really important to public health, and we do a lot around safe drinking water locally in environmental health section. And Jeff Lang, our environmental health supervisor, is with us and can give a little more details. I just wanted to provide just sort of an overview. Public health is responsible through our PE program element 50 with the state for about 280 systems locally. Sarah Poles is our lead for the drinking water program within environmental health. We do regular surveys. Public water systems have to be evaluated every 3 years, more if there's a problem. A lot of all that data is reported to the state. And a lot of the code updates then were basically around the updates to the language that are currently in our contracts. It hasn't been updated since about the 70s, I think. So now that does reflect a lot more of our current practice. I want to just kind of go back to some of these great photos I just pulled off of our. This is the type of surveillance that's done by our environmental health specialists of water systems locally. They do, the surveys involve really end-to-end inspection, and they do a lot of really great work. That data is all fed up to the state and tracked over time. I'm happy to answer any questions you might have.
So any questions for staff on the code changes?
What are these photographs showing?
I'm glad you asked. I took some notes from.
I don't see any water.
Okay, the two bottom tanks there are just
pressure tanks.
A picture of a couple of pressure tanks and then a control system on the bottom right-hand side there. That thing that looks like a faucet there, just to the left of the pressure tanks, is actually the arsenic filter that Saginaw had out there in their mobile home park. And you're all familiar with Saginaw Mobile Home Park. So St. Vincent de Paul has taken that over, and they're doing a great job in updating that. And I'm sure you're familiar with the fine work that they're doing out there. The county is moving to, or the water systems are moving all to steel tanks. The tank on the upper right-hand side is the last of our old redwood tanks. So we have no more redwood tanks. That was up at Shangri-La. If you know of a redwood tank out there, you want to let us know. The other thing I would add is down on the left-hand corner is just some piping systems, and you should know that we're going to we have to draw schematics of all these water systems when we survey them. We're going to some new software that gives us a better CAD type drawing system so that we can send our schematics up to the state in a nicer format. So that kind of describes the pictures there. You should know that we have 280 systems in the county, and that's the second largest number of systems in the state, next to Clackamas County.
And these are all public water systems, 25 connections or more per year, and they're not in cities.
Yeah, these are rural drinking water systems, 10 connections or more.
10
connections or more. Our largest system is probably Oak Ridge.
Do you regulate drinking water in state right-of-way, what is it called, rest stops?
No.
Who checks the drinking water at rest stops?
The state drinking water program, which is an office located over in Springfield.
Okay, so that's an exception to the outside of cities rule. Are there any others?
Right, not that I know of.
Okay. Are these all public, or are these public and private?
These are public water systems for the residents that are connected to them.
But I mean public in the sense that they're owned by the public, by a public entity?
No, they're owned by water. They're owned by the water system.
Okay.
The entity of the water system. The connectors who are there pay the administrator for administration.
How about Lane County Parks?
Lane County Parks, I don't know who does those. I think we do those, but I know we survey them and we monitor their testing.
Could you send an email to the board about who does the drinking water at Lane County Parks?
Absolutely.
Thanks so much for your great work.
You're welcome.
Commissioner Farr.
Just out of curiosity, thank you, Mr. Chair. Out of curiosity, we used to have stone fountains in different places where you just had running drinking water at all times, and we used to drink out of them, but most of those are not operating anymore. And I trust it was just straight groundwater that was bubbling out of those back then.
That's correct. We did come across one over on the coast about 2 years ago, and put it out of commission.
There's one just downhill from Hasita Head Lighthouse that I used to love to get a drink from. Now I have to carry a water bottle. And which one of these, those of us up here may remember this, but which one of these is Petticoat Junction?
So I just have to say thanks for the trip down memory lane a little bit. I could probably have named everything up there with the exception of the faucet. I didn't realize that was actually a treatment system.
Barely.
Yeah, arsenic, that's not exactly a prescribed treatment. But, I appreciate it because there are a lot of these small systems. They're considered public systems because they have more than 10 customers or more than 10 people. But many of them are privately owned and owned by entities that may be struggling financially at times, whether it's an RV manufactured home park that has not really strong management like we saw in Saginaw, or even some of these small districts that are formulated like we saw, what was it, the South Lake Water District or whatever, that had the intake issues down off of out of Silcoos Lake in Dune City, near Dune City, and then what they realized was they had a bunch of water system leaks. That was really, it wasn't an intake issue, it was a water system, water main leak system problem. But it's having some testing and affirmation to the folks that think they're drinking safe drinking water, and that's what your program is all about, really, is making sure those systems are staying safe for the public, because there's such a presumption by the public when they go to the tap, and particularly if they're paying some kind of fee through their ground rents or whatever with their manufactured home, that water is safe to drink, and you guys are really that person that makes sure that water is safe. And I really appreciate the work you do. Appreciate the update in the code. I know that they're constantly changing those codes, because I had to deal with that as an engineer, where what I used to build in the early 90s became obsolete by the 2000s, and et cetera. I think the last Redwood tank in EWEB system was removed in the early 90s, actually up on top of, in the old Hillcrest Water District, they have one left. So, and that wood's valuable. You can actually salvage the wood out on that tank, because having constant water on it, it preserves it, and it actually is really high value wood. So Shangri-La, you actually have an asset in some ways that you ought to replace, because as a sanitary system, redwood is not the best material. We referred those as bug farms. So really appreciate getting a little bit trip back down memory lane there. Any other questions for staff on the actual code changes?
If I'm not mistaken, Shangri-La has replaced that tank, so you better hurry if you want to get the redwood out of it.
Oh, okay. Hopefully they were smart enough to sell it for a decent price. So if there are no questions, I'll entertain a motion on Ordinance 1803. Commissioner Lykin.
Thank you, Mr. Chair. And looking for, here we go. So I'd like to move approval of Ordinance 1803 in the matter of amending Lane Code, Chapter 9, to update public health provisions 9.500 through 9.562 and 9.566 through 9.685.
Second.
So it's been moved by Commissioner Lykin and seconded by Commissioner Williams to approve Ordinance 1803. Any discussion from the board? Seeing and hearing none, this is an ordinance, so I'll call for the roll.
Commissioner Sorensen?
Aye.
Commissioner Lykin?
Aye.
Commissioner Williams?
Aye.
Commissioner Farr?
Aye.
Commissioner Bozevich?
Aye. The motion passes unanimously. Thank you, everybody. So we will jump back in our order, but I want to real quick check in. I guess we got an hour and 15. I think we can get through the agenda. Do we want to deal with item 9B while we've got Chief Nye in the audience, or do we want to get back to Chapter 4? What's your preference? Oh, God. Oh, man. My apologies. We have to step backwards. I missed something completely. We were supposed to hold a public hearing on the last item. We may have lost some staff, but we can jump back and do that. So I apologize. I was watching clock and jumping back and forth trying to figure out where we're going to go in the agenda. So I would like to move back to item 8A. And I think if I can entertain a motion to reconsider, and we'll jump back into a public hearing.
So moved. Second.
It's been moved by Commissioner Sorensen, second by Commissioner Lykin to reconsider Ordinance 1803. Any discussion? I'll call for a voice vote on that. All those in favor, please say aye.
Aye.
Any opposed? Thank you. So with that, I need to open a public hearing on ordinance 1803 and ask if there's anyone signed up to speak. And I'm seeing no one signed up back there. Anyone that would like to speak to ordinance 1803? Seeing none, I will close the public hearing, and now I will re-entertain the motion on the reconsidered motion. Commissioner Lykin.
Thank you, Mr. Chair. And so I'd just like to move approval ordinance 1803 as specified earlier.
Second.
Been moved by Commissioner Lykin, seconded by Commissioner Williams. Again, I'll call for the roll as this is an ordinance.
Commissioner Sorensen?
Especially, yes.
Commissioner Lykin?
Double especially, yes.
Commissioner Williams?
Yes.
Commissioner Farr?
Just plain, yes.
Yes, thank you. And the motion repasses unanimously. My apologies to the board and the audience for that.
Okay, well done.
Yeah, thank you. Good job. Sorry. Now I will ask the administrator which is it. We have both Ms. Moody and Chief Nye waiting for various items. Is there one you would prefer to take first?
Why don't we?
Normal order would be 7B, so.
Is Alex here? I thought Alex was going to be here for.
He stepped in and stepped out.
Yeah. So we have item 7B, which is our lane manual changes, or we have item, we can jump to item 9B and deal with the fire.
Why don't we do 9B since we have a guest here?
Yeah, that's what I was thinking. So let's handle item 9B, which is the order and resolution 1805-0107 in the matter of adopting pursuant to ORS 478-924 fire season regulations and standards for Lane County property. Located within the Lane Fire Authority District, providing for a reasonable level of life safety and property protection from the hazards of fire, explosion, or dangerous conditions during the fire season. And I think Steve Dingle was going to be here to present some of this, because I think there's a little bit of explanation as why this is a resolution versus a normal board order. And I'm not seeing Mr. Dingle coming, but I think we can maybe start off with a little bit of introduction from Mr. Mokrzycki as to why we're being asked to pass this resolution. And here comes Mr. Dingle.
Jumping all over the agenda.
Sorry about that. Just we're running a little late. I want to help some of these folks that have more than enough on their plate get back out on the road. So.
So this is the,
yeah.
Right. Terry, want to step up?
Terry, if you want to join at the table there.
Good morning, members of the board. The item that's in front of you allows basically the county to incorporate some regulations that have been adopted in other districts and delegates enforcement authority. This brings, I think Commissioner Chair Bozovich brought this up, it eliminates the possibility that we have inconsistent circumstances between the regulations that could apply in immediately adjacent pieces of property. And I want to point out that the statute only requires a resolution, but I've added the word order because I've been told that this board has specifically historically limited resolutions to what we typically think of as resolutions, but I wanted to let you know the statute does not require an order. And because we wouldn't be changing the penalties, we don't need to do anything else. I want to let the board know you do have the option of having different penalties than the regulations that you're adopting, but that would require additional action by the board. So we invited Mr. Ney here to talk to you about the reasons behind it, and I'm here to answer any questions you have about the actual order itself, the board order.
Chief, do you want to address real quick why we're here?
Thank you, Chairman Bozovich and Commissioners. Good morning. I'm Terry Nye, Fire Chief of Lane Fire Authority. My district provides fire protection to about 276 square miles north, west, and south of Eugene. The reasoning behind this ordinance that our board of directors passed a couple of months ago is that we have some inconsistencies. About 2/3 of our fire district overlaps with Oregon Department of Forestry protected lands. Oregon Department of Forestry has clear statutory authority to provide penalties for people that violate reasonable and safe burning regulations. The problem is that if you drive down Territorial Road, for example, one side of the road is protected by ODF, the other side of the road is not. So people look across the road and go, why there and not here? We're simply trying to bring some consistency so that we can enforce the same regulations. We're going to totally mirror Oregon Department of Forestry's various standards. When they say the burn condition is high, that's what we're going to do. We're going to let the experts set what the level of risk is and determine that. We're just simply want to mirror that for the rest of our district, including the city of within the city limits of Veneta. And we've passed an ordinance. The city of Veneta has passed a resolution adopting this, or I guess a resolution adopting the ordinance or endorsing the ordinance. And we're asking the county commissioners to do the same so that we have the enforcement authority. This is not something that we need to use very often. Most of the time we go out and provide education, and that's sufficient. But there's that small group of people that have figured out that we really have no teeth. And we'll go out and provide education, and they sit there and nod their heads, and we're back the next day because they're still burning under unsafe conditions.
Thank you. Any questions for the chief or Mr. Dingell?
I have a question for Mr. Dingell about the board taking an action that results in a board order versus enacting an ordinance. Wouldn't it provide greater public awareness of what the chief legitimately wants that we're going to approve if we were to put it in an ordinance so it would be known to the public by looking at our lane code where our ordinances go of what the rule is, and provide at least, in my mind, at least additional legislative authority for the chief and anybody operating under authority of this ordinance, and be able to say, well, it's a county ordinance, it was passed by the Board of Commissioners, they had a hearing, their county lawyer looked it over, it's consistent with state law, and the county's enacting this ordinance, and it gives greater protection to the legitimate activities of the fire folks that have to go out and as the chief pointed out, often confront people, or at least, they're being confronted trying to enforce these rules. Enforcing a resolution seems a little wimpier than enforcing an ordinance.
Chair Bozievich, Commissioner Sorensen, the reason that it's done this way is what you're proposing would be a perpetual delegation of your legislative authority if you were to do an ordinance. And I was just going to mention, what I intend to do is review this annually and add it to our sort of disaster type things. This way, you're only delegating authority to this year to these known regulations, where if you adopted, I don't know what the ordinance would look like, but it would be a perpetual delegation, and it would actually be a delegation and a subdelegation, because one of the things I wanted to point out was if you look at the resolution that does this, it actually incorporates the specific regulations. You're actually making a decision to incorporate the specific regulations of the folks.
I guess I'll just ask you to take a look at the issue of if we enacted an ordinance and said every year the Board of Commissioners is going to pass a board order, and the board order will may delegate authority to the lane fire folks. So I was just missing a step between the state law and our board order, and that, in my view, to be considered by the great folks that work with you. And the idea is an ordinance that makes it clear that the board is going to do this and going to do it annually, and if the board doesn't do it, that's okay, because the ordinance is simply implementing state law that we may do this.
And I think that's actually why I think the reason that the resolution and the delegation authority is in the statute is to avoid the issue that I just raised, which is the perpetual delegation.
Yeah.
And also, I think it's a recognition that circumstances change from year to year.
Yeah.
So
Thank you so much, and thanks for working on this, and I hope we're able to help straighten this out for you.
Thank you.
Yeah, I appreciate the thought of making this permanent code, but it does also reference ORS specifically, which we've tried to get away from having ORS references into our code because the numbering changes, and next thing you know, our code's out of date. So,
yeah, well, that's what I was trying to, Chair Bozovich, that's what I was trying to bring up, which is this is a specific grant of authority under that provision of the statute for municipalities, which include counties, to do this. We would, if we were to do an ordinance, we'd have to create our own. We wouldn't be referencing this, is what I'm saying.
Yeah, we'd have to start more or less from whole cloth. But I do appreciate us looking at this and extending that authority evenly over the district. One just has to recall a certain fire we had off of Clear Lake as somebody was welding farm equipment on a day where ODF had banned activities in the forest, and we nearly lost a few houses. Some fantastic work done that day by the firefighters to save those houses. So it's really important to have consistent closures, consistent regulation over the entire district, because the district does experience the same fire conditions. And I think ODF calls for those closures sometimes may not exactly be fire conditions. It may just be a lack of crew. And they go increase the restrictions to the fact that they've got most of their crew delegated across the state, and they just can't, they don't have the capability to fight a wildfire. And that's really, one of those things that we really have to be careful of.
Chairman Bozovich, that's very true because, for example, last year, my district had 2 incidents where we had crews in California for 2 weeks. It's pretty difficult to recall them from there to deal with our own. And so that would be the kind of things that we might factor in. Of course, those were, especially the second one was very late in. It was after our season. I mean, it was in December, but nevertheless, it could have happened in July, too.
Yeah. And that's one of the things, when ODF makes their decisions, it's not only just forest conditions and the current energy levels in the forest as far as fire carrying capacity. It's also about what are the resources if they do have an ignition. So having consistent regulation across your 251, is that?
276.
276. I couldn't remember quite the number, but 276 square miles of coverage is pretty important. That's bigger than some states, I think.
Quick question. Is this a delegation for a specific period of time? Is it like a year from now, or is it a year from January, or how are we doing that?
This is the ones that we're incorporating are the regulations for this year.
For this year, and when does this year end? Calendar year?
What is it? No, is it a calendar year or fire or other season?
It's not a specific date. It depends on the weather conditions. Typically, it'll be somewhere mid-September, but it can be extended. It can, just depending on Mother Nature, and nature is a mother.
Well, this is maybe a broader issue.
It's for this fire season, whatever that fire season turns out to be.
And is it possible that we could do a 2-year extension through, say, December 31, 2019? And I'm mentioning this because Ms. Cook's in the room, and she's our emergency person, and my sense is we have got a lot of these things that are delegating for a year, and they're kind of calendar year, and I'd maybe like to set up more like a 2-year because we get to the point where some of these things end in December and they start up in January. Not this one apparently, but we often have really bad weather in December and January, and we have often emergencies in December and January. So I'm just curious whether we could have a little bit further rollout, even 18 months, so that there's a rollout of these things and we don't have them all expiring at once, particularly at the end of a calendar year when we often experience emergencies, not fire emergencies usually in December and January, but other emergencies. And so just an idea to think about for the future.
I'll talk to Ms. Jones about maybe staggering that. I know that what we've tried to do is at least it was my understanding that for some of the things that we do annually, like for example, the county administrator's authority to spend money in emergency and those sorts of things, it was the board's desire to basically have a look at them. That is an example of something that continues to exist, but I think Mr. Mokrahajski and I made the commitment that we would bring that back to you on an annual basis so that you could look at it and decide, maybe based on what happened the year previous, that you wanted to change it. So that's kind of where those all get put together that way.
And I think that's a legitimate reason not to do the rolling concept, but maybe a 2-year every 2 years we would do that rather than, because I'm just concerned about the continuity.
I understand.
Thank you.
Any other questions for staff or comments? Seeing none, I'll entertain a motion on the order and resolution. Commissioner Lyken.
Thank you, Mr. Chair. I'd like to move approval of order and resolution 1805-0107, the matter of adopting pursuant to ORS 478.924 fire season regulations and standards for Lane County property located within the Lane Fire Authority District, providing for a reasonable level of life safety and property protection from the hazards of fire, explosion, or dangerous conditions during the fire season.
Second.
Been moved by Commissioner Lyken, seconded by Commissioner Williams. Any discussion to the motion? Seeing and hearing none, I'll call for the vote. All those in favor, please say aye. Aye. Any opposed? The motion passes unanimously. Thank you, Chief Nye.
Commissioners, thank you.
Mr. Chair? I know we're sort of out of order here, and we have a number of staff from Public Works, from the district attorney is here, the sheriff's office. So I asked Christine Moody and Alex Kyler if we could bump them in respect for the folks that are here who took time for item 9C. So if you'd like to take that one up, I think we're prepared to.
That'd be great, because then we won't have to send Mr. Dingle out of the room and bring him back. So unless he had some announcements he wanted to make also.
I'll make one brief one. I'd like to announce that we have filled my former legal secretary that left with Gwen Matilla. So we are now 100% staffed.
Right. Awesome.
At this moment.
Okay, so then we'll move on to item 9C, which is a report from our fatal crash investigation team. And we've got county counsel, and we should have Becky Taylor.
Give up your seat.
And we're going to kick the administrator out for a few minutes, and we have our DA Patty Perlow and Peggy Kepler from Public Works. So who's leading today? Are you leading?
I'm going to start it off with the first slide. First of all, I'd like to acknowledge all the members of the board and thank you for your commitment to moving towards the reducing fatal collisions in Lane County. This is our quarterly update that the board asked for. I remind you that you created this, came up with this idea and created it in 2017. And I think we've explained at the initial one what the purpose of the group is and how we meet. Part of the reason the main reason that I'm involved is because we're trying to find that balance between trying to reduce fatalities in rural Lane County by looking objectively and critically at different crashes, and at the same time protecting the county against liability based upon the findings in there. So that's why I'm involved. And I think we provided the first update on April 6th, and we're here for the second one. So, Becky's got the next one.
Thank you, Chair Bozovich and Commissioners. I'm Becky Taylor, Senior Transportation Planner with Public Works, and I facilitate the Fatal Crash Investigation Team. We start every meeting at the Fatal Crash Investigation Team to report on the number of fatal collisions on county roads that we've had since the last meeting. Already this year, 2 people have died in vehicle collisions on Lane County roads. We get our crash data from Oregon Department of Transportation, and they haven't yet released the 2016 data. We're still working with 2015 data. However, even though we don't have their official data, we do get preliminary data, which was included in your agenda packet. And here's some fatal collision statistics that we have on Lane County roads for the years 2016-17, and then this year, as of April 30th. 10 people died on Lane County roads in 2016, 11 people died on Lane County roads in 2017, and again, already 2 people have died this year. These statistics exclude city streets and state highways, and the point is to show that this is a pressing public health issue that we need to diligently work on, and really appreciate the board's support in this effort and adoption of the Transportation Safety Action Plan earlier this year.
As Becky just showed you, we continue to have traffic fatalities. It's a pressing public health issue. We've just given you some of the data, and now we're going to talk about some of the things that the team has done. And I would just say that we don't just look at, and I think you'll see from the way that the presentations that are coming, we don't just focus on one particular area like engineering or well, for example, engineering or remedial measures. We also look at proactive measures, and Becky's going to talk about some of those. And one of the other ones is enforcement, of course. That's what the 3 E's are. And in a moment, we'll have Patty talk about a new position that was approved on the consent calendar today for a DUI investigator, and how that's going to help reduce these fatalities. And then Peggy's going to talk about some of the engineering stuff.
We have a video to show you. This was produced by Devin Ashbridge with Metro TV, and it's a public education video on transportation safety in Lane County and highlights the work of the Fatal Crash Investigation Team.
Buffer.
Yeah.
I know I've watched it at least 2 or 3 times myself.
Okay. This video is on our webpage. Look for the Transportation Safety Action Plan webpage, and you will find this video. I'll give a shout out to Rob Zako is in the audience today. He's a safety advocate. He's testified before you in support of our safety policies, and he's also been helping us promote this video. Excited to share that there's Devin's to the rescue.
There you go.
Crash Investigation Team. This is a new effort, and the team consists of public health, Lane County Sheriff's Office, and our public works, our engineers, our construction and maintenance staff getting together and looking at every single fatal collision that occurs on a Lane County road to figure out what can we do to avoid that type of collision in the future so that we can save lives and reduce suffering. The team is looking at all of the tools that we developed in our Transportation Safety Action Plan. So they're looking again at the entire spectrum of, are there educational campaigns we can do around drunk driving or going too fast? Are there engineering solutions like adding a sign? Are there enforcement opportunities? Can we target our limited enforcement resources on a particular corridor where we have problems? The leading crash type in fatal collisions was roadway departure, in which someone just completely drives off the roadway. Also, the leading contributing factor in all fatal collisions was excessive speed, so people are just driving too fast. So we know that with attention on just those two things, keeping people on the road and slowing them down, we can drastically reduce the number of fatalities in Lane County. Now, those are largely behavioral issues, and so it does require multiple approaches, including enforcement, education, and engineering.
What can people do to help us make sure that our roadways are safer and we reduce the accidents and fatalities on our roads?
Please, everyone, slow down. Getting somewhere 5 minutes sooner isn't worth risking your life of yourself or your loved ones. Thank you for your patience with that.
Thank you, Devin.
Yes, Devin is wonderful. And again, she helped create that video. Okay, an exciting new education initiative, bringing driver education to rural high schools. The names listed here, it was an informal coalition involving Lane Education Service District, Lane Council of Governments, Oregon Department of Transportation, and I facilitated a couple of meetings with some rural school district superintendents from Mapleton, Marcola, Fern Ridge, and Blatchley, and with the private providers of driver education. Currently in Lane County, most driver education is provided by private providers, no longer in the public education system, no longer in high schools. And they're most often offered in the metro area, so it's challenging for rural high school students to get access to this education. And this education is important in creating a safety culture for the next generation of drivers. What this initiative does is creates a coordinator position at Lane Education Service District funded by Oregon Department of Transportation. And that coordinator position will be able to facilitate training between providers and get them located in the rural schools. There is a funding gap that needs to be filled to cover tuition costs. This coordinator position will help develop a scholarship account, and we'll be working together to solicit sponsors and donors. So please keep that in mind, that we will be looking for funding to support this effort. The way that Lane County can also help this effort is for the Fatal Crash Investigation Team to help influence the curriculum, to have a focus on drunk driving, for example, not just hands on the wheel technical skills, but just broader safety issues. And I'll turn it over to Steve.
And of course, the third E is enforcement. And the first thing I'm going to do is turn it over to Ms. Perlow to talk about the new position that was approved on the consent calendar, and then I'll talk about recent concerns that have been expressed by residents, and a tool that we're very anxious to obtain that I think is going to help us go a long way towards reducing these fatalities. So with that, I'll turn it over to Ms. Perlow.
Thank you. Good morning. And while I have the mic, I want to first announce that this is National Drug Court Month, and we'll be having a graduation on Friday. If you haven't attended a graduation, or even if you have, please come. It's really moving and inspiring. Beyond that, I want to say thank you very much to the board for approving our grant application for a DUI investigator. As you all know, enforcement is a key component to reducing our traffic fatalities in Lane County. I'm convinced that every time someone gets behind the wheel of a vehicle in this county, they're making a risk-benefit assessment. Am I going to get caught speeding? Am I going to get caught driving impaired? And generally, the conclusion that they're drawing is no, because we don't have a lot of patrol on our rural roads. So what can we do in response to that? When somebody is apprehended, driving impaired, we want to make sure that they're held accountable. We receive about 500 DUI cases a year in the DA's office, and in order to hold people accountable for that offense, this DUI investigator position will help assist as these cases have grown more complex to prosecute. When I first started, it was really formulaic how to prosecute a DUI case. But now with the addition of drug-impaired driving and the consequences of that, and the increased number of drug-impaired drivers that we're seeing, having somebody to be able to do follow-up investigation on all of these cases is really crucial to successful prosecution and accountability. So I'm very, very appreciative of that opportunity and look forward to coming back to you over the next few years with the metrics behind that and what our success rate is.
Thank you. And as I mentioned, there's also been input, and I think you heard about some of it in public comment. We certainly received an email, and I understand that Jackie Rice is one of those individuals, and she's here in the audience today. And this had to do with the Mohawk and Marcola and Mohawk Valley area where there have been some fatalities, and a request or a suggestion by them that that the DUI laws be strengthened to carry certain minimum mandatory sentences. And what we talked about this in the FSIT meeting, and of course, as you know, those laws are preempted by the state, and it's always difficult when you go to the legislature and try and do something like that. I wanted those residents to know that we're trying to have an immediate impact in their area today, and that type of legislation, certainly folks can pursue that, but that is a down the road, if you will, solution. And I know some of the board members have served on the PSCC, and you know, whenever you introduce the topic of a mandatory sentence, it begins as sort of a cascade of a number of different other conversations, and especially in terms of the impact it has on other parts of the criminal justice system. But I wanted those residents to know that we have actually looked at, I think, at least one, maybe two accidents that were in that area. Yeah, so we have looked at that. And finally, this one's very exciting. We talked about this at our last meeting, and it's just one of those things that, as someone who did prosecuted fatal crashes 100 years ago, the idea that this new technology from Faro is just unbelievable. In terms of when I think about being a prosecutor and having the ability to reconstruct these things, number one, much more quickly. These things tend to take a long time, a lot of hand calculations, which creates all kinds of issues in terms of the way that your expert can be attacked. But really what's more fundamental is the way that this thing can actually create a 3D reconstruction of the event from any perspective that you want to look at it from. It could be from inside the car, it could be from on top, it could be from either side head on. I mean, it's just fascinating. And it's incredibly helpful. Not surprisingly, it's incredibly expensive. It's $100,000. We are currently, the FSIT team is currently exploring a whole variety of potential funding mechanisms to try and get to try and get this technology and make it available for the county in investigating investigating the fatalities, and I think also producing the kind of information that will help both our engineering department look at these crashes as well as Ms. Perlow and her staff prosecute them. So, but it is pretty amazing technology. Currently, the city of Eugene has one, but we're looking at trying to get one for Lane County. Engineering.
Good morning. Last year, we actually started looking at our pavement preservation projects. We started putting in rumble strips. We had about 15 miles of rumble strips that we put in last year. This year is going to be another very busy year. We are doing probably 35 miles worth of rumble strips on North Coburg Road, Crow Road, Fox Hollow Road, and also Marcola Road. And as it turns out, that many of these roads are one of our most dangerous areas that we've seen. We've had a number of fatalities on each of those. So we will be looking at each of our preservation projects over the next construction seasons and implementing different engineering safety measures that might help to keep people aware of where they're at in the roadway and avoiding crossing over the center line or into the shoulder areas. This year, we actually are going to do 20 miles of rumble strips on the Marcola Road itself. We are actually going to do the center line and the shoulders. So that's going to be the first time that we've actually done the center line. We also have a map system that we've set up because of the amount of engineering projects that we have so that folks can see where different activities are occurring throughout the county. We have a number of projects that are going to be in the Cottage Grove area, and part of the changes that we're doing in engineering is to work with the community, doing more public outreach. One of the techniques that we're going to use, I think, in this one is that over the next year we have London Road where we'll be installing more rumble strips. Those will include overlay projects. We have some culverts that are going to be replaced. We also are looking at Sears Road, where we're looking at the entire right-of-way and removing fixed objects that might be in the clear zone, and some bridge projects out there, deep culvert projects. And with the number of projects that we have in the area, we're looking at doing a community safety awareness program with the community and see if we can't get some community champions that could look at different aspects of safety that they want to continue in that area. So with this link that we also have the ability to take a look at the construction zone, and then there's on the side is a storyline as to what's going to be happening in the area so that people are aware of the construction and the type of construction, and also doing public outreach with them.
And if I could, just to follow up on the outreach piece, one of the other things that the group is talking about and what we're trying to actively organize right now is in Cottage, is to have some remote meetings, if you will, in communities that are at and areas where they have these issues. We think that's going to provide a couple of advantages. Number one is we're going to find out what the residents think the issues are and listen to what the suggestions are that they have for resolving it. And the first one of those that we're talking about arranging is in Cottage Grove with former Commissioner Stewart. He's going to find a location for us to have that meeting. And then, of course, we'd notice it, let people come, and we would hear what they have to say. So that's a really important piece. And eventually I could see us going to some of the residents in Marcola and the Mohawk Valley, too. That's it, right?
So, questions from the board or comments? Commissioner Lycan.
Thank you, Mr. Chair. And so I got to tell you, I'm really pleased to hear this whole idea of having our community support and the folks, the champions, as you call it. I think that's really going to be the key. And Ms. Rice, thank you for being here. Really appreciate it. And I was so, when the three of you came a couple months ago, I think, something like that, I think we stated then that it's folks like yourself, that's going to be the most help to Lane County and our staff. And I know DA Perlow talked about the fact we lack patrol. It's not only county rural patrol, OSP, Chair Bozovich has mentioned this several times, that OSP is a third of what it was 30 years ago, or whatever that time frame is. And so we don't have that patrol that out there like we do. And so what's going to be important for us is the citizens out there talking about, hey, here's some areas here that we need to really have a focus on. And to me, that's going to be the most helpful, because like we've talked to here many times, Lane County's almost the size of the state of Connecticut. I mean, it's a vast, large area. And now the good news is we're hearing more and more from Washington, D.C. that we're beginning to hear that rural America is actually back on people's radar again. And it was neglected for quite some time, unfortunately. And I think you could see by the last budget bill, there was significant infrastructure money that really has gone to what I call rural America. And even though we're classified as an urban county, which I think is ridiculous at times, we have one urban center, but the reality is we have almost 1,500 miles of roads that are in rural Lane County. And so I think that's the good news coming out. And as we know, because the last bill, our budget that was passed, it tripled the amount of money, no longer called Tiger Grant. It's now called the Build Grant, but it's tripled the amount of money. And if you go through the process itself has been really streamlined to allow for much more opportunities for rural America. And so there's good news coming out of D.C., but the reality is it's going to be folks, boots on the ground, and the everyday citizens to notify us. And I know we have our champions in Mohawk Valley, and I'm very pleased, but having champions in different parts of the county will be very, very key. And I appreciate anybody willing to step up. And Ms. Rice, if a group of your folks want to have where our staff comes out, and I believe after we redistrict, Mohawk Valley is now my district, part of my district, and so I'm more than happy to go out as well and really have staff give you an idea of what some of the things we're trying to do. I think you got a good idea here what we're doing within our in a sense, I don't want to say limited resources, but that's the reality what we face, but also just being innovative. And I think that's great. And it's great to have engineers, transportation planning, the law, district attorney, law enforcement, all working on this together. This is how I think we're going to finally get to this, where we will no longer say, hey, we're number one. This is the last. I hope we're not number one here for the years to come. I'll be curious to see what 16 numbers are, but it's been pretty brutal. 14 and 15, that Lane counties have the most fatalities out of any county in the state. Actually, Clackamas is 2, and that number's 34. So it drops down, way down compared to Lane County. But great job, great presentation. I want to say thank you very much, and for all your dedication. And again, I just want to point out to Ms. Rice and the folks out in Mohawk Valley and all throughout Lane County that are willing to step up, be champions. Thank you very, very much for doing that.
Commissioner Sorensen.
I just wanted to not only thank the citizen advocates such as Ms. Rice that are here, but also all the great work that's being done on this effort. I just have a few questions. One is, do you have a budget for this committee? Who provides the money? Usually the answer is the taxpayers, but how is the money provided for the work that each of you are doing in conjunction with this activity?
We just do it as part of our.
So there's no budget for the committee. There's a budget for each one of you for the jobs you hold, but there's no overall budget for the committee. Is there a formal recognition of the committee? Is it a committee of the Board of Commissioners? Is it a county committee? Is it a multi-agency committee? Is it not a committee? It's a team? Could you just tell us
We have
what you think that is.
We have a formal recognition and rules among ourselves. I don't know what we commit.
You get together, call yourself a team.
Yeah, I don't think there's actually a
There's no I in team.
It's not in the code or manual.
Yeah.
I think we call ourselves a team. I think it would be more under the rubric of a task force if we look at the way we define things with.
Well, since you don't have a budget, I don't know who will do this, but I would ask that you at least put together something that says Lane County authorizes this team and the members are 1, 2, 3, so that there's a little bit more recognition by the board, and it can be listed as, and maybe we would have a liaison of one of the 2 rural commissioners to be a liaison. We have that structure on a lot of our committees and teams and task forces and different other things. So I think that would be a way to, and then what do you think about the idea that we would actually have a budget? Like just say, okay, in the budget, we create a line item called, what do you call it, traffic death team, or is it? Fatal crash investigation team, something like that. Was that what you have, Ms. Perlow? You have something like that in your office, don't you? Or is it a fatal investigation team?
We have lawyers on call who have gone to crash reconstruction school in order to be able to prosecute those cases.
Okay, all right. Well, maybe I'll just leave it to you, but I do think that a little bit more formality so that the board is aware of it, and it has, whether or not you want a budget or not, a lot of our committees don't really have budgets anywhere, or if they do, they're just part of the budget of whatever department, and maybe it could be Public Works, because 2 of you are from Public Works, and some of the county council's funds come from Public Works. So maybe that's the best thing. Anyway, thank you so much for your good work, and give some thought to that. But I would like to see it a little more formal. There was a traffic safety committee of the Board of Commissioners maybe 20 years ago that was terminated by the board, and now we have this, and I think that this should be more formalized. Thank you.
Thank you. So I guess a quick question before I get to my comments, because from playing off of Commissioner Sorensen's, we adopted a Transportation Safety Action Plan.
Right.
Was the fatal crash investigation team part of it? Was that an effort that was recognized in the TSAP? I thought it was kind of contained in that, and that's how you guys got started, was our adoption of the Transportation Safety Action Plan.
This team helps implement the Transportation Safety Action Plan. There was a general action in that plan to bring county departments together to implement enforcement, engineering, and education solutions. And so staff from those various disciplines essentially volunteer to go above and beyond their call of duty to work on this issue. And we don't have a budget. Wanting more endorsement from the board and funding, I won't object to that, but I'll talk to Steve about our structure.
Yeah. But I thought I remembered there being something in the TSAP that kind of initiated this whole effort, so that we have taken some formal action as a board, because we did take a formal action to adopt the Transportation Safety Action Plan. Any other comments from other board members? I'll just note real quick that the work we do, even though you only gave numbers for Lane County roads, really makes the whole county safe. And as we work on our pieces, it makes a state highway safer as we educate people about driving too fast, and as we pursue DUI, because you don't just do our county road DUI, you do the entire county, period, even municipal, and if it's felony DUI, is your crew. So it's adding that isn't just about Lane County roads. I want to make people understand that this isn't just looking at county-owned and maintained roads. It'll improve traffic safety throughout the system. And with that, we need to be working with our partners and across jurisdictions. And one of the things I'm appreciative of is the City of Eugene moving forward with their regulations on ride sharing, which I think is going to improve our DUI occurrences where people can actually call for a ride, and get rides fairly easily. Along with that, at the Public Safety Coordinating Council, we've actually had attendance from an ODOT specialist on impaired driving. I can't remember the gentleman's name.
Dan Estes.
Yeah, Dan, sorry. I knew you would remember. And we actually, Becky's been attending the Public Safety Coordinating Council meetings, and we're, that's top of mind at that interjurisdictional meeting, to that how, traffic safety is a piece of public safety. So it's really risen up in prominence. And I think, the work we do here with your team, the feedback we get from, why we're seeing these fatals and what changes we need to make is going to pay off over the whole county. So I'll be looking forward to seeing the overall county numbers and seeing if they're trending down, that include non-county roadways, include the municipalities and the state highways, because I think we're making a really broad effort across multiple jurisdictions here on traffic safety. Thanks to advocates that are sitting in the back row.
And if I can, Chair Bozic, the group is actually specifically looking at the challenge that is rural ride sharing, because it's clear that Uber and Lyft and those sorts of services inside the urban areas have had an impact, a favorable impact. The difficulty, of course, is when you're talking about much greater distances, trying to get people to buy into the idea that, they might be 14, 15 miles away from where their car is going to be left. So we're actually looking at some things that I think it's from Colorado, is that right? Am I remembering right? The one?
I don't recall which state, but there is another state that has a successful model.
And we're going to look at trying to implement that here.
Great. Well, any other questions for the team?
I have a question. Is that all right? Are we including insurance companies in this? Because they have a great interest in the outcomes that we're having. And I know when my kids were learning to drive, before the insurance company would insure them as drivers, our agent made them come in and meet with him and take a packet and fill it out and watch a video and record hours. And because they knew what the risk was of insuring two young drivers. And so I think they would have an interest in what we're doing here.
Yeah. Yeah, I think it's a great idea. I think they could potentially be a sponsor for this driver education program in rural schools. Great idea.
Well, thank you for the suggestion. And thank you for all your hard work, everybody.
Thank you.
So with that, we will jump back to item 7B, which is Order 1805-0106 in the matter of amending Chapter 4 of Lane Manual to revise management policies. And we need Christine Moody and Mr. Mokahaiski back. You didn't get your JD?
Sorry, what?
I said you didn't get a JD? I saw you were the council.
Good morning. Thank you, Chair Bozievich.
Good morning.
Commissioners. So we're bringing before you Lane Manual Chapter 4. It includes the general term there of management policies, but so I thought I would just go through the different subjects that are covered and make a few comments and then open up for questions. So the reason that I have ended up being the one presenting this to you is that there are the financial and budget policies that start out the chapter. So I do want to go through a few of those, and I'm just kind of going to go through the chapter. So we have, Lane County previously did not have a structurally balanced budget policy. You've heard us talk quite a bit about that the last few years, about making sure that ongoing operating revenues square up with ongoing operating expenditures, and so we're adding that. We're also strengthening some items around having more financial forecasts, some financial plans for all of our operating funds. We're talking about the financial reports that we come to the board and setting that as a biannual requirement in the manual. Right now you get quarterly financial reports. John Mosby in the budget office has been doing those. So it's not that we won't continue to do them quarterly, but just kind of keeping the requirement at least twice that the board will hear from us on those items. We are tightening up around fees, that those are reviewed annually by departments, whoever is responsible for that fee, to make sure they shouldn't be adjusted, and making sure that it's clear that those need to go through finance and audit before they come to the board. And then expenditure side, we have some clarification around contracting for services, intergovernmental agreements, just about when those should be reviewed. And then finally, we get down into general fund. In the final section of the expenditures there, we talk about general funds and making sure that reserves for the general fund stay in the general fund. That we, of course, have general funds going out into other funds for reserves when we're saving for equipment, PCs, fleet, those type of things. But other than that, the reserve stays in that fund. And then we go into the reserve policy for the general fund. So the board did hear quite a bit about this last year through the budget committee process. We talked about how this policy was being developed. Previously, there was a 5% minimum reserve for all funds in the county and 10% for the general fund, which when we looked out to what the Governmental Financial Officers Association recommends, they say you should have at least 2 months, which means you're getting up to about 16.6%. So we knew that we were a little low with the 10%, especially as we have become more dependent on property taxes with the SRS payments going away or being delayed. So the property tax is not coming in until December, means we need to have more funds for cash flow prior to that time. So the recommendation, after going through a risk assessment that GFOA has out there, where you can kind of look at what other safeguards do you have in place as a county, meaning that we have a risk fund, we save for unemployment, we don't have any other big risks that the general fund would have to pick up. The recommendation was about a 20% reserve as a minimum. So this policy establishes that. We also have in here some guidelines, which are pretty similar to what was in the prior general fund policy around when you might use the funds, when you might need to draw down the reserves, some guidelines for what the board would look to, usually economic based. If there's something going on in the economy or you have a sudden dip in one revenue source and you want to bridge some funding, that those would be times to pull from the reserve. Finally, we also have a maximum reserve in here that we have put at 25%. That would be, you could go over that if the board had a plan to go over it. So we've basically said 25% maximum unless the Board of Commissioners has made a plan. And we say if it does go up, then the budget officer, who's a county administrator, should come to the board and talk about that plan, what that plan is for. So that was something that we did not have before. We also, before I go on to the road fund, in general for other funds, we have now removed the requirement for a minimum reserve for all fund types. The reason that we're recommending doing that is that the 5% was very arbitrary. It didn't match the service types that were occurring in funds. Places like parks, where you start the busy season on the first day of the fiscal year, you need a higher reserve than 5% before you start collecting fees. Other places, it's just pass-through money, so that reserve was sometimes impossible for the fund to do because the fund should not stay in the fund. And so we've said that those will be reviewed and set throughout the budget process. Then we do have a road fund reserve policy, which is new to the board, and there's an executive summary on that, and Tanya Heaton is here if you have any specific questions on that. It's framed very similar to the general fund policy with different sections of it, except they also have a catastrophic reserve because of the assets owned by that fund. It's also a much higher percentage, I think 45%, because of that asset ownership of the billions of dollars that they are maintaining. Then I'll just quickly go through the other sections. You also have investment policies, debt policies, interfund loan policies within this chapter. A lot of this is cleanup language. One thing on the interfund loan policy, we are changing it so that you can do a 10-year capital loan between funds. That was to match statute. That has changed. We do have just some cleanup language in a section that's related to road fund real property assets. And then the video lottery allocation policy. This is meant to clarify the language, so there's no overall change. The policy basically says that the board directs that about 50% of the funding from video lottery should be spent on infrastructure investment projects out in the community. We kind of look at the internal split versus the external split of those funds being spent each year in the budget. We did soften the language just a little bit to say the board will strive to do that. That's to give you more discretion there in case in any one year you wanted to slightly switch those percentages a little bit. Then we have just some cleanup language on the computer resources is in this chapter also, and the Firewise incentive program is also in the chapter that cleans up some language with ORS. Some formatting indicates that the designee of the Public Works Director can go out to property, not just the director themselves. So with that, I'm open for questions, or if you'd like to hear more on the road fund, as I mentioned, Tanya's here.
So questions for Christine or Tanya? Seeing none, then I'll entertain a motion.
Mr. Chair, I'd like to move approval of Order 1805-0106 in the matter of amending Chapter 4 of Lane Manual to revise management policies.
Second.
So it's been moved by Commissioner Likens, seconded by Commissioner Williams to approve the order. Discussion to the motion. Commissioner Likens.
Thank you. Real quickly, Mr. Chair. So this did come through Finance and Audit, and we had a pretty thorough conversation, and I thought it was vetted pretty thoroughly. I just want to thank Christine and the entire team. I mean, really, just a really good job on this, and really a big thanks to Steve and his leadership. Just kind of where we're going from a budgetary and financial standpoint, where Lane County is today compared to where we were even just start of this decade. It's pretty amazing, and great job by staff. So that's just my comments. Thank you.
Any other comments? I'll just echo that. I think this is memorializing some changes we've made over the last couple of years with the budget, and particularly recognizing some of what Moody's review guided us towards in the way of reserves that helped us obtain our really high rating for bonds. And I just want to note that even 45% on the road fund, when we're talking about a $6 billion asset, doesn't seem like enough. But I understand the real realities. And there is, if we do get into a storm event or a major disaster, there's always the federal help that comes in at that time. But it's just still $16 million doesn't seem like we'd use that up in a hurry in a single bridge, failure or something like that. Yes, or major landslide. So I just still. It's a lot more than what we used to call for, but I appreciate knowing that we have limitations too, and it takes time to build reserves. And I appreciate the work here. And it is something that it's difficult for people to understand, particularly they get a hold of our CAFR and they go, wow, look at all this money Lane County has. And no one really understands that we are holding this large amount of money in our solid waste fund for the closeout of the landfill, that we're required by our federal permitting for the landfill to hold that money there. And we have a large amount of money we keep in the road fund for disaster, and we have to keep that money there. And it's just not fungible for services. And if we were to tap it, it'd be one-time money. And I think that's one of the things people have difficulty understanding. So I appreciate the update on all these lane manual changes, just to catch up to everything and the great work and to continue that great financial work we've been doing. So with that, if there's no further discussion of the motion, I'll call for the vote. All those in favor, please say aye. Aye. Any opposed? Motion passes unanimously. Thank you, Christine. Which moves us on to discussion of the Marble Muralette Draft Survival Guidelines and an opportunity to comment. And we have Mr. Kyler.
Thank you, Chair Bozovich. Members of the board, I'm Alex Kyler, your Intergovernmental Relations Manager. Before you have a packet that I prepared, this is just a discussion, there's no motion contemplated here, but it does, this issue of what we're calling the uplisting of the marbled murrelet by the State Fish and Wildlife Commission has brought forward a number of sort of questions for the board to address, and I tried to get at both of the questions in the board packet. So first question is, do you want to participate in the next step of public comment around the listing by the State Wildlife Commission for the marbled murrelet? And the second is, we realize that perhaps we need some improvement in coordination about what sort of communication the Board of County Commissioners gets with respect to these kinds of agency actions versus what kind of notifications staff gets. To the extent that there's a disconnect there, we might want to do a couple things to sort of try to repair so that we're sure that we're not missing opportunities to comment. And I bring that up because we did miss an opportunity to comment on the actual uplisting of the marbled murrelet. The reason that the board might want to be concerned about the listing of the marbled murrelet is that in terms of the state lands that are impacted, Lane County does have some 25 or 27,000 acres of lands that are managed by the Board of Forestry that the county at one point in time actually had received and transferred over to the Board of Forestry for management as part of what's called the Council of Forest Trust Land Counties. So the lands that Lane County receives revenue from, that the Board of Forestry manages, are in Western Oregon, and they're probably right on the verge of the marbled murrelet's habitat. The marbled murrelet is a very tiny bird that normally spends most of its life at sea, but comes inland to nest. And so we think that those lands that the Board of Forestry manages on our behalf are potentially within its nesting habitat. So changes to how that species is treated moving forward could have some revenue implications for the county. As I indicate in the packet, we typically receive sometimes a fair amount of money up. I think we saw over the last couple of years as much as about $780,000 that had come into the county from revenues received from those lands. Those revenues are not always, not completely available to the general fund. So under statute, there are some of those dollars that go to the county school fund, and there's some of the dollars actually go to a couple other revenue funds as well, depending on what taxing districts exist within that area. But irrespective, there is some financial impact that we may see, the county may see, as a result of having the marbled murrelet uplisted. So, as I indicated, the Board of Forestry, or excuse me, the Board of the Fish and Wildlife Commission is what it's called, did choose to uplist the marbled murrelet, and I think that happened on February 9th, 2018. There were a number of counties that made comment. We did not. The next opportunity for comment is that the Fish and Wildlife Commission will undertake what's called a survival guidelines. And so it's essentially a plan for how to implement the uplisting of the marbled murrelet. That is scheduled to be in front of the Fish and Wildlife Commission in June, early June. And my understanding in looking at their documentation is they should have that draft guideline out for us to comment on now. But frankly, I haven't seen it. It's not listed on their website. I am now on a sort of the list of interested parties, so I should be receiving this document once it does come, but I don't have it at this moment. But that is the next opportunity for the board, if they so wish, to provide comment on the survival guidelines. That's what this next plan is called. Concurrently, And somewhat related, the Board of Forestry is also addressing issues related to the marbled murrelet. The Board of Forestry, their interest is to ensure that as they undertake projects on the landscape, they have to address impacts to the marbled murrelet. And so they have a document called a technical review. And that technical review first hit the Board of Forestry last week at their April 25th meeting. There was public comment at that meeting that was accepted. My understanding is that the Association of Oregon Counties did provide comment, and that comment looked at exactly what I was discussing earlier, which is that depending on how the Board of Forestry manages these lands, there may be some fiscal impact to the affected counties and taxing districts for that matter. So that process is, from my understanding, the adoption of the technical review at the Board of Forestry leads into potential changes either in rule or statute to the how the Board of Forestry implements the Oregon Forest Practices Act on these lands. So that's sort of a concurrent process that's moving forward. So we got two opportunities for the board to weigh in on policy documents related to the marbled murrelet. The second part of this board packet is we need to sort of tighten up how we become aware, how staff becomes aware of these kinds of issues when the documentation from the state, or typically the alerts from the state, don't necessarily come to staff. They typically come to the board chair or to the Board of County Commissioners. And so we've thought of a couple ways we might be able to assist the board in making sure that we're aware of these kinds of notices as they come in. One recommendation may be that we just address, have a standing item in the agenda setting team to talk about recent communication to the board. The other one is that when U.S. mail comes to the front counter that's addressed to the Board of County Commissioners, it's scanned into an electronic document and forwarded to the board. I could be CC'd on that and would receive, at least be able to put another set of eyes onto that process. And then we're also hoping, just by having this conversation, that, you know, when the board receives stuff that they may be interested in, it needs to come in front of the board. There's needs to be some way to get that into the staff milieu so we can schedule it and be prepared to present. So two sort of separate things. Clearly, the latter is more of an administrative function, but the former is definitely need to get a sense from the board if you really want to have an opportunity to comment on this, the implementation of the uplisting of the marbled murrelet. It'd be well for staff to know that so we can start to prepare some of those documents, because there is sort of a time certain that public comment is typically accepted. So I think that's it in a nutshell, Mr. Chair, and I'm happy to entertain any questions.
Okay, so I'll start out real quick. You know, if maybe we can get just a quick poll of the board on do we want to be involved in the draft survival for survival plan for the marbled murrelet. Is that?
Yeah.
1, 2, 3, 4 head nods. Sounds like that we wanted to stay involved with that and possibly be involved in public comment. So clear direction there for you. And I will say that this original notice came to me and was buried in a whole bunch of other. I must get 10 notices a week from the Forest Service. Some of them are about trail closures in Tillamook County. I don't know why they come to me, and I just missed this one in the stack of stuff and didn't get it to Alex in time to comment on it. And I noticed that I get correspondence from being board chair 4 years ago, you know, where on things, and I noticed that a lot of the stuff I get now as board chair still has either, you know, I still get stuff with Faye's name on it.
Yeah.
as board chair from some of the agencies. So the consistency of agencies in notifying the board sometimes is really not consistent. So we have to develop some way of pooling these notifications that may be addressed to a single commissioner and making sure staff understands it and it rises to board level. And I don't know if that's something we do at agenda setting period where we have a time for board correspondence, and if there's correspondence that comes into individual board members not on the agenda team, they forward it to the agenda team, or whether we do that as part of board business, commissioner's business, and do it during a public meeting.
Thank you very much for raising that issue. Number one, I think that we should just have a policy, written or unwritten, that all intergovernmental matters be referred to the person that's heading up that function in Lane County government. You're right. We get all these things all the time. I think 3 years ago I got my last Commissioner Jerry Rust, so maybe 15 years, 18 years. Dear Commissioner Rust, okay, I am a federal official and I'm supposed to contact county commissioners. Thought I'd let you know. Well, I think 10 years ago I stopped forwarding these things to Jerry. Figured, well, he's probably not going to want to deal with it. So my point is, I think we should just have a policy that if it's asking for public comment, if it's asking, we just send it. I personally get a lot of email from the Siuslaw National Forest, the Willamette National Forest, saying they're going to close a trail. In fact, I think I recall the Tillamook thing, and I just pretty much ignore it. So I think if we had a policy of just whenever we get something either in the mail or we get something from email, just to send it to him. As far as what he does with it, what Alex does with it, I personally think it's really between Alex and his boss, Steve, and the committee that Alex reports to, namely the legislative committee. So I don't think it should go to the agenda team. I think it should go to either Steve as the person in the administrative hierarchy that Alex reports to, or because we have a board committee that deals with interactions with other governments, that's the place to put it. I don't think it should go to agenda team. I think it would actually be inappropriate for it to go to agenda team.
And Mr. Chair, I'd just add one additional layer to that. I think what commissioners can do is, as it relates to the legislative items, forward those to those communications to Alex, and the same communication can go to Diana Jones, and she can then, if there's an address correction that needs to occur, she can take care of updating that address, notifying the agency about who the proper party is, and then keeping a list. We currently don't have a centralized list of different agencies and points of contact, and so as positions change over time, we can notify them of that proactively in advance, so we can avoid commissioners who haven't been here for 10 years still getting mail. So that would be just a suggestion, to give afforded both to Alex and to Diana. I think we'd kill a lot of birds with that. Not the marble murrelet bird. Yeah. But careful. Pun intended.
Careful with your metaphors.
Yeah, right. We don't want to kill any marble murrelet.
Yeah. So is that
good news, Mr. Chair, is that in my recollection, we've only had 2 of these where we sort of had some sort of notice coming from a state agency and then missed a deadline and sort of had to bring it to the board's attention.
Yeah. But I could see where it would happen fairly easily. Yeah. So just a kind of heads up to the entire board to try and help our staff help us by forwarding those notices on. So with that, I think you got your direction on continued, us being involved in the next step, and we'll try and be better about our correspondence here. I'd like to move on to Commissioner's business, if we can deal with that, and then I can read us into executive session. We won't have need to come back out in a public session this afternoon. So
I won't, Mr. Chair, I just wanted to let the board know, because Commissioner Farr asked last time. I'll give this update next week, but I did have an update on SB 1051 related to the ADUs. So I have that, but I'll hold it till next week because I know we're running late.
Okay, thank you. So are there any commissioners' announcements? And
Well, it's a timely issue regarding Hayward Field and the historical designation that is being sought for the East Grandstand. Been talking to the University of Oregon. I'd like to ask the, now I'm wrapping agenda team requests into this, ask the agenda team to look at a discussion. I'd like to do it next Tuesday, but we've missed today's agenda team meeting, to have a discussion regarding the impending decision potentially by the City Council that may disallow the upgrade of Hayward Field Stadium by the University of Oregon. It's timely in that they're moving forward with the preparation for the 2021 games, and the university is of the opinion that any disruption in the schedule for the upgrade of the stadium is going to be detrimental to the 2021 games, potentially losing the games for the Eugene, Springfield, Lane County area. So it's timely that we have a discussion on this and potentially have a position by the board regarding what I would hope would be support for the University of Oregon's renovation of the Hayward Field Stadium. There's a lot that goes into that, and there are a lot of talking points that I can address, but the historic designation is significant, but the point is that it's not necessary to completely preserve the entire dilapidated East Grandstand. And it will be difficult to lock, stock, and barrel move the East Grandstand, which some people are calling for. There are 7 layers of lead paint on it, for instance, and some intense rot in the understructure. So more than we can talk about after, it's already afternoon, but I'd like the agenda team to discuss this, and I would request that we discuss it as it may need to be added as an emergency item for next Tuesday's agenda, but that we discuss it at next week's agenda regarding where the board stands on the University of Oregon's upgrade of Hayward Field.
I see a head nod there. Yep. There's 3 head nods, so we'll...
Mr. Chair, the agenda is not final we did have agenda team.
Yeah.
If you make that request now and you have head nods to add it to the agenda for next week, we can do that.
Yeah, I think I'm trying to remember how tight next week is, but I think...
Well, we have a budget committee meeting in the afternoon.
Yeah.
So we'll talk, pending the schedule and the timing, we'll try to get it on for next week for discussion.
Yeah.
The question is if there's anything you want with that, if you're requesting specifically a draft of a communication or...
I'll provide just a couple of paragraphs to you, Mr. Mulcahy, this afternoon, just kind of talking about the discussion items surrounding it, including a 6,000 square foot museum that is going to be incorporated in the new structure. So, thank you.
Thank you. Any other agenda team requests? So, review of assignments.
That one. The discussion for next Tuesday related to the University of Oregon's plans for Hayward Field and the existing facilities.
Did you want to? So just under other business, I think we got some communications from the Corps of Engineers that Commissioner Williams distributed to the board.
Thank you, Mr. Chair. And this is a letter written, Mackenzie River Chamber of Commerce and folks up the Mackenzie River have some concerns about fish plantings that occurred this past month. And they have a letter, y'all have a letter before you. They're asking that we send a letter of support for what they're requesting here. And I would ask that we consider that and draft the letter.
So is that a agenda team request to get a support letter drafted and maybe on a future agenda?
Either that or head nods.
Yeah. Got a thumbs up there?
Yeah, I'd give head nods to that.
Looks like we have head nods to draft a support letter.
Thank you.
So add that to the assignments. Any other assignments we missed? Any other business for the board this morning?
Mr. Chair, just very briefly, Captain Buchwald received a pretty significant award from sponsors on Friday night, and I'll not go into detail of it right now since we are running late, but I'm pretty proud of the work that Captain Buchwald does in terms of making certain that people who are leaving jail don't go back to jail. So way to go, Captain Buchwald.
Yeah. He's doing some amazing stuff, and particularly out of Veterans Legacy, too. The man's got a lot of energy. So with that, I'm going to read us into executive session, and we are not planning to come out of executive session to make any decisions. So the Board of Commissioners will meet in executive session to conduct deliberations with persons designated by the governing body to carry on labor negotiations. This executive session will be held pursuant to ORS 192-6602D, which allows the Board of Commissioners to meet in executive session for the purposes listed. Representatives of the news media and designated staff shall be allowed to attend the executive session. All other members of the audience will be asked to leave the room. Representatives of the news media are specifically directed not to report on any deliberations during the executive session except to state the general subject of the session as previously announced. No decisions will be made in executive session, and we do not plan to come out of executive session. So we are in recess until 1:30, and we'll reconvene in the Board of Commissioners conference room in executive session. We are in recess.
I don't know how time sensitive.